Hi everyone, welcome to our Sunday webinar. We are going to get started in just a few moments.
Okay.
Are we doing the video, Maisa?
Yeah, we're recording, I think. Good morning and good afternoon, everyone. Thank you for being here. We have a distinguished panelist team with us today. Welcome, everyone, and we will introduce everyone as the time comes. Our webinar today is called Forced Displacement is a Public Health Catastrophe. Forced displacement is also a war crime against humanity. We know as a medical community that forced displacement puts the population at very high risk for a multitude of diseases, especially chronic diseases and mental health issues. It lowers life expectancy. It puts social pressure on the family. It ruins the dynamic between the community. It ruins the dynamics between parents and children even. So it is a fate that we do not wish on anyone. And in Gaza, after such a catastrophic 15 months of utter destruction of everything that sustains life, we are standing against forced displacement with all our power. We, as a medical community, will be on the Hill in Washington, D.C., supporting resolutions that talk about the opposition of forced displacement in Gaza. We are also supporting another resolution that is related to refunding UNRWA. UNRWA is a UN organization that is very important for the sustenance of food, education, and health in the occupied Palestine. And there is a very strong war against it by the Israelis because they know that the destruction of UNRWA will mean the destruction of so many aspects of Palestinian lives. So we will be focusing on many things. We have Dr. Youssef Abu Rish, and I will give it to Dr. Nidal Jabour to introduce Dr. Youssef, please.
Thank you, Karam. So thank you, everyone, for joining Doctors Against Genocide webinar. Me and Dr. Karama Hawash are the co-founders of Doctors Against Genocide. We are both Palestinians. I'm from Al-Khalil, Yatta, Al-Khalil. Dr. Hawash is from Nablus. We also have Dr. Abla Sukar here with us. She's a Syrian American and married to a great doctor from Gaza. We have Maisa Hawash, also a crucial member of Doctors Against Genocide. She's also from Nablus. We have a great list of speakers and panelists today. We are honored to have them. Thank you, everyone, for joining Doctors Against Genocide. We're going to start with Dr. Yusuf Abri. She's the Deputy of the Health Ministry in Gaza. Thank you for joining us, Dr. Yusuf. We are honored to have you. Dr. Aburish has been on the forefront, leading the Gaza health sector through 16 months of genocide and the relentless attacks on hospitals and the systemic dismantling of the healthcare infrastructure. Despite the so-called ceasefire, the genocide continues by other means through deliberate deprivation, forced displacement, and the blockade of life-saving aid. The genocide also continues in the West Bank, in Jenin and Tulkarm, with mass destruction of civilian infrastructure, forced displacement, and deliberate attack of the healthcare system there. Dr. Abrish, let's start with you. We know that Gaza hospitals have been systematically destroyed, the medical personnel deliberately targeted, and even the humanitarian corridors obstructed. The people of Gaza continue to face mass death, indirect killing, displacement, starvation, and medical deprivation, all of which are deliberate acts. Israel and the United States have failed to abide by their agreement to allow medical and humanitarian aid. leaving Gaza in a catastrophic public health emergency. We also recognize the illegal detention, torture, and killing of healthcare workers. We here notice our dear friend and colleague, Dr. Hussam Abu Safiya, as a friend who used to be a usual guest on this webinar. We know that he's illegally detained and being tortured by Israel as we speak. They even called him an illegal combatant a few days ago to deprive him of any legal or constitutional rights and to extend his detention without any charges. We know that there is a complete collapse of the critical medical services in Gaza, shortages of ambulances, the ICU capacity, the oxygen, all these essential supplies are lacking. This genocide is continuing through deprivation. So first of all, if you can tell us, Dr. Abrish, please, how did you survive 16 months of active genocide and active killing? And also, if you can describe the situation now, what is happening now, what are the needs of the health sector in Gaza, and how we as a medical and global health community can we help you to be your voice to try to affect change and help our people in Gaza. Thank you, Dr. Abrish. You are muted, Dr. Yusuf. You are muted, please. Can you unmute?
Assalamu alaikum. First of all, I would like to thank you for this invitation. And the second thing, I would like to apologize for my poor English. I'll try my best, but if there will be any obstacles, I think you will support.
First of all, can I intervene, please? This is my famous comment. Do not apologize for your poor English, because English is the language of the genocide. There is more truth in your language, in your native Arabic. So speak in Arabic, please, if you wish, or speak whatever English you can. I think there is more truth in whatever you say than any language barriers. Thank you.
So to save your time, I'll try to speak in English. But if I'll need any support, I think you will do. First of all, I think all of you are aware that they start by that decision for the Gazan people in that genocide with no water, no fuel, no food, no electricity, and no medicine. And we start from the first day, day number one, receiving hundreds of cases. Actually, in some days, in the first days even, we received more than 1,000 of the murdered people. And you can imagine at that time, how is the situation when I'm talking about the emergency department, while it's overwhelming with a huge number of cases, even to the extent that even we were unable even just to move between the cases. Most of the cases were managed on the ground. The smell of the blood is there, and even the smell of the death was there everywhere. Unfortunately, we were unable to cope with this very huge number of cases. And in spite of being just protecting the health system, unfortunately, we shifted from protecting our protected health system not to non-protected, to attacked and targeted health system. And so they start to target the hospitals, the primary healthcare centers, the ambulances, and the staff themselves. At that time, no one was feeling good, safe. And they start to target, as I mentioned, even the expert staff. I think they were so clever to attack the very expert doctors, and even in some specialties, for example, we missed all the doctors there. I can refer, for example, to the histopathology, the doctors Dr. Hussam Hamada. He is the famous histopathologist in Gaza. Unfortunately, he was killed. And the second doctor after him, Dr. Muhammad Dabour, again, he was killed. Unfortunately, the third one, who's Dr. in the Gaza hospital, in European Gaza hospital. Abu Reda, again, he was injured. So you can imagine all the doctors and the histopathologists, either they were attacked and killed or were severely injured. And that was the case for most of the different specialties, like Dr. Rafat Lubbad. He's the head of the internal medicine department at Shifa Hospital. Unfortunately, he was killed himself and the rest of the family. Dr. Sirin Al-Attar, the famous and brilliant doctor in the obstetric and gynae. Unfortunately, she was killed, herself and her family. And so, as you know, more than 1,000 of the health staff were killed and hundreds were detained. At that time, unfortunately, no one can start talking about the health system while the pillars of the health system is not there. I'm talking about water. There's no water. The sewage system, unfortunately, while they are destructing the infrastructure, the sewage system was running between the people and the displaced people. And as I mentioned, anyone who can move, he was just a target. I remember at Shifa Hospital, we received more than 50,000 of the displaced people that they think the Shifa Hospital will be safe for them. And you can imagine the burden of that huge number of cases on the infection prevention, on the water supplies, in the toilets, in the food. All of that burden were extra burden actually on the health system and on the shoulder of the health system. And we faced many obstacles at that time. For example, I can refer to the electrical supplies after they stopped the fuel from the entrance into Gaza. And we depend solely on the electrical generators. And in spite of those generators to be there, just to work for 15 minutes or half an hour or 1 hour or 1 day and to be just a standby, we continue depending on the electrical generators during this 1.5 years. And you can imagine, even we were deprived from the spare parts. Till now, we are unable even to bring some of the spare parts and the filters and the lubricant oils. And all the time we are just on the top of our toes, as we'll not be able to provide the health service if any of the electrical generators will be stopped. And that was the situation actually. All the time we were just following the different generators just to be able to cope and to continue working in that situation. We unfortunately missed more than 70% of the bed capacity, and we started to manage the cases in just 30%. Even before this genocide started, we were planning to double the number of the beds in Gaza, as we are not even reaching the half of the needs of the population. And in spite of that, we were managing the cases in just 30%. And because of that, we missed many cases as there were no accessibility. I can just refer for one number, which is the hemodialysis and the chronic renal cases. We missed 40% of the cases of the chronic renal failure. And unfortunately, they were unable, till now, they are unable to access the hemodialysis machines. And in spite of being connected to that machine 4 hours in each session and the 3 sessions weekly, they were connected just 1.5 hours and twice weekly. So 3 hours out of 12 hours supposed, or should be 12 hours. And that's why they were, unfortunately, we missed 40% of the cases. Actually, it's the same when I'm talking about the cardiac cases and the other cases who unfortunately they die silently while we are unable to do for them anything. I'm not talking now about the casualties and the murder cases. I'm talking about the other part of the story, the hidden part of
Dr.
the
Yusuf,
story.
Dr. Yusuf, you mean 40% of dialysis patients died because of lack of services. Yeah.
Exactly.
So this is the indirect killing. I mean, the active killing was the bombing and the injuries. Then indirect killing, all those people
Yeah.
who have chronic illnesses are not getting enough care, and they're dying silently without being even
Exactly.
counted as
Exactly. And
the
actually, that number and that service, we can calculate directly because the total number of the cases who are in need for hemodialysis, it's easy to calculate them. But the other cases, unfortunately, even we're unable to even to record. And I can refer to the first invasion in Shifa Hospital. The first thing they did in Shifa Hospital, they were targeting the health information system, storage and system. And at that time, we have backup at Arantisa Hospital. And the second hospital, which was invaded, again, the Arantisa Hospital, and they were targeted the health information system, even not to be able to reflect the health status at that time. We struggled at that time, even just to count the number of the cases who are killed or the cases who are injured. And you can imagine at that time, even Biden himself, he started to talk about the fake numbers of the killed people. And at that time, for the first time, we published the names, although I think we pushed to do that. And we missed the dignity and the privacy of the cases names, but unfortunately we were pushed to do that as they would put a question mark about the total number and the real number of the killed people at that time. And at that time, even we were unable to communicate each together. The internet was collapsed and the direct call was collapsed, and you can imagine that you are unsafe to move and you are unable to communicate with the rest of the your staff. And the leadership of the Minister of Health were fragmented, and we are unable even to communicate each together. And as I mentioned, all of the health staff, mainly the senior staff, we were feeling that all of us were at the list of hitting and targeting. So it was even so difficult to move from hospital to another. At that time, I can just refer for some of the cases in Shifa Hospital. I want to tell you about the nature of speech and dialogue which was between us at that time. We were using the phrase that fortunately, they didn't left anyone behind them, because we start to feel the pain of the people when there will be one survivor out of the family. So we start to use, unfortunately, there is one survivor. Unfortunately, there was no one left behind. And you can imagine to have one survivor. Now we have more than 2,500 who are the only survivor in the family. When I'm talking about two survivors, there is another almost 1,800 with two survivors, but the vast majority of the people were killed, the whole family. And we start for the first time to use that phrase. Unfortunately, there is a survivor at that time. I can't remember
If I may, Dr. Aburish, so what you're describing is a deliberate attack on the healthcare system in whole, as doctors and nurses, and even the archives and the data system, system of erasure. This part of the medicide that has been, ongoing and committed against the people of Gaza. And what you're saying that, you lost all kind of communications, you lost all your systems. And there is a lot of research now that the numbers that the health ministry is issuing for the number of killed and murdered people is actually a gross underestimation of the actual numbers. So what you're saying is true, because you lost, I mean, they destroyed everything. You have no capacity to keep up with, to count even the actual numbers of the victims, and all the research and the Lancet and everyone, all these studies that says that it is estimated the actual number of deaths is at least 3 to 5 times what the health ministry is reporting. So what you're saying actually gives some credibility to that research. Yeah.
Gaza is so small, and I never before imagined that at one time we'll have a dead body there who is unknown. Actually, we never face a such situation, but unfortunately, this time we first, for the first time, hundreds of the cases who are labeled like unknown people, and actually, all of those people were not recorded, as we are just only recording the people with full data, just with the name and the four names and the ID number and the birth date and everything about him. So anyone who's not filling the data, he's not recorded and he's not calculated. And that's another reason why it's the number is underestimated, because we are not publishing some of the unknown cases. It shouldn't be like that. So we are just publishing the people with the full data, and that's another reason. And now I can even just imagine at that time when they invade the Shifa hospital, we were unable even to move from one building to another. And I can remember our colleague who's called Muhannad. Muhannad, he was one of the engineers at the Shifa hospital. He was just shooted by the drone captor and in his neck, and unfortunately he was paralyzed, and within a few hours he was dead, as we were unable to manage him. And in that time we were unable even to move from one building to another. I think you remember the story of the neonates who were at the maternity hospital, and we were unable even to move them, as they were managed without electricity, without anything to support them, and they start to suffer from cold injury, and we were unable even to move them from one building to another, and we start to coordinate it through the ICRC just to be able to move them from one building to another. At that time, I can remember that time very well, that even we have a decision, although there was no food and no water, but if we have some small amount of food at that time, we decide not to eat, because if we'll eat or drink, we'll go to the toilet and the bathroom, and unfortunately there is no water in the toilet and the bathroom, so we decide not even to eat or to drink, not to be pushed to go to the toilet at that time. I can remember that guy who was 14 years, and he was the only survivor of his family. He was almost completely burned, and without anyone to support him, he was struggling there with massive pain. And he was just at the early burning. He was able to talk, and he started to tell me, uncle, please, can you just stay and stuck just behind me? Unfortunately, I was not able even to stay more than 5 minutes, as I had to go there and to follow the other cases and the management of the health system at that time. Unfortunately, after a few hours and 2 days, actually, he died. He died alone, without being without being able to be supported by anyone. Even the health staff themselves, they were unable to support anyone, as their families were killed, themselves were injured. Lots of people are there, and they were all the time just struggling to ask the people about their families, while they are unable to even to contact them, as there is no network just to call them at that time. And then they push the people to go to the south, and they start to target more intensively the hospitals at the north. And I can just refer to one call. Even before they detained Dr. Hussam Abu Safiya, I received a call from one of the Israelis guys there in from the Ministry of Defense, as they mentioned, and he told me that we are going to attack Kamal Udwan, as there is a military activity and we are going to invade Kamal Adwan. I tell him, look, you know very well that there is no military activity, and I can just tell you or give you some choices. Well, first of all, why not to be inside Kamal Adwan? And if you will be inside Kamal Adwan, you will monitor everything inside Kamal Adwan by yourself. And if you wish, you can go there at the admin floor and to be there, and you will be more than welcome to be inside Kamal Adwan. If you will not be able to go there for a reason or another, why not to be in front of Kamal Adwan gate, and then you will monitor anyone who is going to be inside or outside. And the only thing which I ask for is to let us complete our humanitarian mission and to treat the cases. I can ask just you, if you want to go inside Kamal Adwan, you are more than welcome. I tell him that at that time, you will be more than welcome. If you want to be in front of the Kamal Adwan gate, again, that will be okay for us. Just we ask you just to let us complete our humanitarian mission and to treat the cases. And he mentioned, no, I'll not do that, and I'll not do the other thing. So I tell him, so Kamal Adwan, you know that Dr. Hussam is there, and there is no any military activity. And he start to ask me, okay, this is the time to go to the Indonesian hospital. I tell him, but the Indonesian hospital, unfortunately, you distract the infrastructure of the Indonesian hospital. So if you want us to go to the Indonesian hospital, it's okay, but give us the opportunity to refix the Indonesian hospital first. He said, okay, that's okay. We'll manage that. And at the early morning of the next day, the bulldozers and the D9 was destroying the remaining infrastructure of the Indonesian hospital, even without any hope to manage any case at the north, just to push the people to go to the south. Actually, they were not only destroying the stones and distracted the devices, actually they were killing the hope of the people to be alive there. You know that Kamal Adwan and the other hospitals is not just giving the medicine for the people and not managing them only for the usual diseases and the casualties. Actually, they're giving them the hope, the light, and even the water. You know that the people are unable to catch the water, access the water, and they can collect some of the water from the hospitals, as we have some wells inside the hospital for our own use at the hospital. And that was part of the situation at that time. Rafah border even was closed, and the people and most of the cases which we actually are struggling in, and we are overwhelmed with the cases, and even they have a decision to close Rafah border and
Doctor,
even to give a
Doctor,
hope to be referred them outside.
Doctor, if I may, you're raising a very important point. What you mentioned about the discussion between you and the Israeli genocidal army about the Kamal Udwan hospital. This actually is a very important distinction to highlight the difference between a war and a genocide. In war, the civilian infrastructure is not a target, and any army will target only the militants. You already told them that they can come and have a station and be stationed at the hospital themselves to check for themselves. If there is any suspicious activity, they can be in charge of security.
Exactly.
And if their intention was war and their intention to go only against the combatants, then they would have agreed to this. Instead, they rejected your offer because their intention is to destroy the hospital itself, the civilian infrastructure itself, the source of hope for the people. This is part of the deliberate and intentional attack on the healthcare system and any sources of life or hope for the people, and destruction of the people to force them either to kill them or to force them to leave. And this is, by definition, is a medicide. It's intentional. It's part of a genocidal process. Genocide, you destroy all means of life, all means of survival for the people. And that's exactly, your discussion highlights this point very clearly. Just thank you for bringing this up.
Yeah, and at that time, even we were struggling because the other sectors are not working. For example, the Minister of Interior and the policemen were targeted again. And so the situation was so chaos. Some of the bad guys started to attack the health facilities and the health personnel and the other sectors, as I said, the municipalities and all the other sectors. Unfortunately, they were totally collapsed, and even the health system was just managing the situation alone without being supported by other sectors. And again, it was something crucial. As for example, we were not able even to send some of the solid waste of the hospital and the medical waste of the hospital, and it was accumulated inside the hospital and in the layout of the hospital and around the hospital, as there was no municipalities and no one can even just collect the solid waste management. That's the same when I'm talking about the sewage system, and it's the same when I'm talking about the food and the availability of the food. And now I'll just summarize that period, which lots of story are there, lots of cases are there, lots of faces I still remembering, lots of smells I still just feel. It's just like now it's in my nose. And I'll shift to the situation now. And if the direct killing is stopped, unfortunately, the indirect killing is still continuous. For example, before this genocide is starting, we have eight cath lab for cardiac catheterization. Now we have just only one, which is a very old one, very old-fashioned in European Gaza hospital. And unfortunately, even without consumables and without the very essential needs to do cath for them. So still now, there's some of the people, they are losing their lives while we are waiting. I'll just mentioning now the obstacles which we are just facing just right now after even the pause of the ceasefire. First of all, the supplies. I'm talking about the medicine. You know that there is the essential drug list, which is containing almost 500 items, while in the private markets, it's more than 5,000 items. And the 500 items, the zero stock of the medicine, 45% of the essential drug list at the zero stock, 40% of the consumables at zero stock. Again, the lab reagent, it's the same, and the spare parts is the same. That's number one. Number two, as I mentioned before, the pillars of the health system, which is called the socio-economical determinants or the health determinants. I'm talking about the safety of the water. You can imagine we collect some samples of the water, and although the amount of the water is so few and so limited, even that amount is not suitable to be used by a human being. And at that time, we collect. It's just one month ago, and the situation is still running at the same percentage, which is 30% of the samples which was collected, it was biologically contaminated. And that can explain nowadays the still running polio virus. You know that unfortunately we investigate for the polio virus after we did a campaign, and unfortunately it's still circulating as the sewage system is running between the people and there is no clear water to be used. I'm talking about the safety of the foods, while most of the foods were stuck at Rafah border, and now they start to enter some of the foods which is out of date and it's not suitable to be used. And unfortunately, even we are not, as the health system, not at Rafah border now to investigate the food and to decide if that food is safe or not safe. And again, as I mentioned, till now, we have no system after they destroy and destruct the devices of the management of the medical waste. Unfortunately, now we are not managing any of the medical waste, and we just push them around down to the street while some of the children are trying to collect something just to use for cooking or something like that.
Can you correct me, please, if I'm
Yeah.
mistaken? I think that polio campaign was never completed in the north. They did not allow it to complete. They gave the first dose, but did not allow the second one. So, I mean, that also explains why the polio is still
Yeah,
going.
yeah. You are right. Actually, there is many reasons. One, which is the malnutrition and the lack of the immunity. So they didn't get good immunity to that virus. And the second one, in spite of just doing the campaign at one time, Gaza was divided into three phases. And at the north, unfortunately, lots of obstacles were there, and we were unable to reach all the children. And the other one, which is the water and the sewage system. So many reasons. It's a multifactorial one. So this is the number two I'm talking about after the supplies. Number two, which is the public health destruction and public health determinants, which was totally distracted. Number three, I'm talking about the electricity, and still we are struggling without being able to the solar system and without being able to have some of the spare parts. And till now, they are not allowing anyone to bring some of the electrical generators, as they mentioned, it's a dual use. So unfortunately, we are unable even to run the hospital with a full capacity. Some of the hospitals, like Nasser, we are unable to run the hospital in a full capacity as there is no electrical generators enough to support all the departments. So we start to use part of the hospital while we are in a bad need for each room, for each bed, for each ICU beds. Unfortunately, we are unable to use all the hospital facility as the electrical support is not enough to support all the departments. Number four, actually, it's not only the electrical generators, the oxygen stations, unfortunately, they distract most of the oxygen stations, and we are struggling. This morning, I was at Shifa Hospital, at North Hospitals, and we are struggling there, and we are unable to run even some of the ICU beds as there is no oxygen source and there is no oxygen stations to support the ICU units inside the hospitals. And unfortunately, again, as they don't accept any electrical generators to enter to Gaza, again, they are not accepting any of the oxygen stations to enter to Gaza. And
I just, if I may, please, I just heard that in the news about the oxygen, actually. North Gaza alone used to have 20 units or stations to produce medical oxygen. Out of the 20, there is only one now that is running at half capacity, and that is not, of course, not enough to provide enough oxygen for all the hospitals in the north. So most of the ICUs and the neonatal intensive care units are not functioning because there's no enough oxygen. Can you imagine? I mean, even the 20 stations were not enough before because of the siege, and now they are only limited to only one half functioning station, half capacity.
yeah, we are not depending on the liquid oxygen. Our system is not depending on the liquid oxygen as it's need special arrangement, and we are depending on the oxygen concentrators and to produce the oxygen through that stations. And as you mentioned exactly, most of the hospitals now we are trying after they distract. You know that at the north they distract Beit Hanun hospitals completely, which was mainly focusing on pediatric and other specialties, but mainly pediatric, and they distract Kamal Udwan, as you know, and they distract Nasser Hospital completely, and they distract Ad-Durra Hospital. Now we start to refix Ad-Durra Hospital, and we are trying our best to restart Arantisi Hospital, but unfortunately, we are unable to restart them completely as there is no oxygen source for the ICU and the neonatal ICU. Previously in Shifa Hospital, there were 24 operation rooms. Now there's only 2 operation rooms, and we are unable even to expand more. If we'll be able to expand more, we are not able to actually to expand. But if we'll be able to expand more, unfortunately, there is no oxygen for them, and there is no oxygen for the ICU, and the 55 neonatal ICU at Shifa Hospital, it's completely distracted. And we are trying now our best to shift some of the cases and some of the incubator to Arantiso Hospital. But again, the problem that we are unable to fully fix that unit as there is no oxygen. Actually, the number is more than one. We have one at Al Ahli Al Arabi, and we have another one at the Indonesian hospital. It's now pending to be restarted, but with a small capacity, and they are unable to cover all the needs. Even some of the people they are in need to have some oxygen cylinders for themselves out of the hospitals, and unfortunately now they are struggling and they are unable to manage. For example, the chronic obstructive lung diseases, all of them, they are depending on oxygen, and nowadays unfortunately they die in peace, as I mentioned, silently, without being able even to be supported with oxygen.
So it's not just dialysis patients who are dying. It's the COPD patients, the cardiac patients, all the cancer and oncology patients, all people who need all this intensive chronic care are dying because there's the complete lack of medical support and system. Thank you.
Yeah, exactly. Number 4, which is the radiological devices. I'm talking about the CT scan and the C-arm. I'm talking about the X-ray, the basic X-ray. All of these machines were distracted. The vast majority of those machines were distracted, and unfortunately, they are not allowing any other machines to enter Gaza. For example, the C-arm, which is so necessary for the orthopedic surgeon. Unfortunately, all of the machines now, they are not functioning. And we have some of the machines, we pay for that machines, and they are now at the West Bank, but they refuse to give us a permission to enter, to bring some of that machine. The CT scan is the same. The lab cath is the same. The basic X-ray is the same. So even the other machines.
Sorry, what's their excuse? What's their excuse of not allowing a medical machine, an X-ray or a CT scan or a C-arm or an MRI to get in?
Actually, they are not pushed to tell us about an excuse for that. Actually, it's just rejected. And whenever we put more pressure, they will tell us that for the security reason. I don't know how they can use, for example, MRI. We have MRI through JICA. Now we have MRI at the West Bank, and we are unable to bring them, as they refuse to bring them for more than one, even for more than 1 year, even before the genocide. And now it's more than 2 years while we are waiting for that MRI at the West Bank. At the same situation is applied when I'm talking about the cardiac authorization and the C-arm and the other machines. Again, the number 5, when I'm talking about the critical medicine, the emergency department and the theater and the ICU and the neonatal ICU, unfortunately, almost all the emergency departments now is distracted. Now we're trying our best just to restart the emergency department at Shifa Hospital in the only area which can be used for that, which is the outpatient department. Actually, they completely distract Shifa Hospital, which was containing 700 beds at that time. And the emergency department was able to engulf and to manage 100 cases at one time. It was the biggest emergency department. Unfortunately, it's completely distracted, and now we are trying our best just to manage some of the cases like trauma stabilization point in the outpatient department, as there is no longer emergency department. So I'm talking about the critical medicine. Number 5, which is the ambulance system. And again, they distract most of the ambulance system, and they are not allowing to bring the batteries. You know that now for more than 1.5 years, most of the ambulances, now the batteries are not functioning, and it's not allowed. You are not allowed to bring any batteries from outside. And even ايش معنات الاطار اطار السيارة الكاوشوك.
The wheels, yeah.
The wheels after all of this duration, all of the wheels now, they are not suitable to be used, and even the wheels is not allowed to come inside Gaza.
So
And
they're
now,
not even allowing wheels for the ambulance.
The
The few
tire.
ambulances live there.
yeah,
Tires,
exactly.
yes.
Tires.
Tires, sorry, the tires.
Yeah, the tires. Yeah, the tires, exactly. And the number 7, I can refer to the human resource, as some of them were killed, more than 1,000, 100 are detained, and some now they are out of Gaza, and the remaining, unfortunately, some of them now they are planning to leave. And we face, really, we face regarding the human resource at that time, during this escalation, during this genocide, we face a plan at that time and hidden agenda just to completely destruct the health system and to have a parallel system. And we were always facing the very difficult decisions, like for example, the field hospital. You can imagine that one organization, they brought a field hospital, just the skeleton of the field hospital, without any equipment, without any devices, and without any staff. Actually, they were planning just to drag our staff and our system, our equipments, and even they start to whisper to us, why not to save your equipments and to send some of your equipments to the field hospitals? Actually, for me, there was a clear decision just to collapse the already remaining health system, and we're planning to have a parallel system. And even while we were able to give the staff $200, 800 shekels, which is almost $200, they start to pay for them $6,000. So you can imagine our staff, they start to tell them, you will be, come to our field hospital and we'll give you $6,000, while we were unable to give them apart from $200. All the time we will face such decision. I'll tell you another example for such difficult decision at that time, which is the ambulance system. You know that some of the ambulance were used by the Israeli forces. And it's something so crucial, as the ambulance are able to move everywhere and no one can stop the ambulance system. Out of the blue, and after they start to arrest many of our staff in the ambulance system, and they start to attack the ambulance system out of the blue. For the first time, one of the organization, I never heard about that organization before, they came to tell us that we are able to move inside Gaza, and we can coordinate as international NGO with the Israeli side, and we can help you just to evacuate some of the cases from a place to another, even through the checkpoints of the Israeli side. At that time, you have to decide to allow them to move there while they are unknown for us, and even they can be used for any other reason, or you will refuse that, and some of the cases can be died while we're unable to evacuate them. The same of the field hospital, just to let the field hospital to be there, and there is a clear decision just to collapse or to destroy the remaining of the health system, or not to give them a permission to do that, and then you can miss some of the cases. And so the answer was all the time, yes, but, and we're trying just to put some conditions and not to go for the negative part of the story. Actually,
So, Doctor, you're saying that some of the international NGOs are playing, kind of a suspicious role of enabling the genocide and destruction of the native healthcare system. And you mentioned also about the Israeli army using the ambulances. Can you elaborate more on this, please? Because I
Yeah.
mean, they usually blame the other side of doing that, but it seems that you have evidence that they are the one who actually using the
Yeah,
hospitals for military purposes.
yeah, as I mentioned for the field, first to start by the field hospital, as I mentioned, they start to attack all the hospital. And at one time, we have even no one public hospital at the north. At the south, we were only depending at that time on the small hospital at Rafah city, which is Tel Sultan Maternity Hospital, and An-Najjar, which is very small hospital, and European Gaza Hospital. That was the only remaining part. At that time, they start to ask us why not to allow us to catch and to bring or to take some of your devices from Nasser Hospital and the other hospitals and the Al-Aqsa hospitals. For us, they tell us like that. The story is so clear, Dr. Youssef. They are going to distract the remaining system. So now this is the only opportunity to give us your equipments, to give us your devices. We'll save the remaining of your system. And at that time, we were fully aware that actually they are planning to destroy the remaining part of the health system. As I mentioned to you, they were giving the staff $6,000 apart from the $200 which we were able just to pass to our staff. As I mentioned for the ambulance, in many occasions, and mainly at Shifa Hospital and the area around Shifa Hospital, our colleagues, they mentioned that there is some of the ambulance system which is not ordered by the ambulance department, and they are moving around the Shifa Hospital. And in the day after, we at that time they were around Shifa Hospital in the second invasion, and they start to use the ambulance system, our ambulance system. They were used by the Israeli side by special forces. إيش قوات خاصة. Special forces.
Yeah, special forces, yes.
Yeah, special forces, just to be able to reach Shifa Hospital and to enter Shifa Hospital without being noticed by any of our staff, as they are thinking that they can do something inside Shifa Hospital, and they think at that time there is some of the resistance members inside Shifa Hospital. So they use the ambulance system and they use the field hospital just to collapse our system. And that's another obstacle, as I mentioned now, our ambulances without batteries, without any spare parts. Number 8, which is the primary health care. Mainly, after I'm talking about the UNRWA, you will know that the UNRWA were covering 70% of the people, as 70% of the people inside Gaza, they are labeled like refugees. The UNRWA is giving the service for the school for 50% of the people inside Gaza. And at the health system, they are covering 70% of the primary health care. And now the UNRWA are unable to cover that number. Now it's very limited capacity of the UNRWA. And even our primary healthcare centers, most of them, the vast majority are destroyed. And in spite of having 52 primary healthcare centers belonging to the MOH, we are just having now 14 out of the 52, and some of them are just partially functioning. The health information system and the different registries, this is another obstacle and another challenges, as it's so important to have the file system and to be able to monitor some of the cases and to search for the file of the cases, to be able to manage them. Unfortunately, they destroy all of our health system. We are unable even to reflect our health status in certain numbers, like the maternal mortality ratio or the neonatal mortality ratio. And even we are unable now to calculate the number of the died cases of the indirect cause, as I mentioned, apart from some of the disease like the chronic renal failure. The other point, which is the materials which can be used for the rehabilitation. Unfortunately, there is no materials at all. For example, to have concrete or something like that, and all the pipelines, the oxygen pipelines, and all the electromechanical systems, nothing are there. And even if we have money just to repair or rebuild or rehabilitate some of the health facilities, unfortunately, there is no materials at all to use. And that's another problem. Until now, they are refusing to bring or to allow any of the materials which can be used for the rehabilitation. Another file, which is the disabilities, and using of the assistant devices and the rehabilitation. There were 3 hospitals for rehabilitations. One, which is Hamad Hospital, it was for hearing, and it was for rehabilitation and for the artificial limbs. Again, it's not functioning completely. They completely destruct and burn the hearing department at Hamad Hospital. And the other hospital, which is Wafa Hospital, Al Wafa Hospital, and again, it's not functioning. The third one, which is belonging to the BRCS, and again, it's not functioning. And now, unfortunately, we are facing a real problem. And nowadays, I'm not talking about few number of cases who are in need for rehabilitation or artificial limbs or assistant devices or even hearing devices. Unfortunately, that the huge number of cases we are unable to manage, and this is another challenge to deal with the disabilities. The other one, which is the mental health, till now, unfortunately, there is no mental health strategy how we can have intervention. And I can tell you that 100% of the people in Gaza, they are in need by a mean or another for mental health support and for psychological support, starting by me, myself, and the rest of my staff who work at that situation. And still we are facing the people, and we are facing the needs of the people while we are unable to do anything for them. Other challenges, which is the referral abroad. Till now, they are just referring very few number of cases. We categorize the referral cases as A, B, and C. And for the C, we are not calculating the C cases. We are just calculating the A and B. I'm talking about 12,000 cases. Till now, we were able to send out of Gaza just 300 cases out of the 12,000 cases. On the number 15, I think it's now we're reaching, I think it's number 15 or something like that, which is the specialized services. I'm talking about the cardiovascular cases and the cancer cases and the other cases and the limb reconstruction. I just focused on the limb reconstruction as one example. We are expecting that the number of the people who are in need for limb reconstruction, it's almost 20,000. And you are fully aware that they are in need for special care and very expensive materials to use for the limb reconstruction. And that 20,000 cases out of the 120,000 cases, they are in need for, as a minimum or as an average, 3 operations during the coming 2 years. So I'm talking about 60,000 operations are needed just for limb reconstruction. And you can imagine the huge number of cases who are in need to be operated just only for the limb reconstruction. The waiting list, actually, most of the waiting list now, unfortunately, they are not managed. And now it's no longer some of the cases, it's not something which is luxury or something which is real cold cases. I'll just explain the situation. For example, if we have an old man, for example, who's just living in his home, if he was blind, completely blind, or he closed his eye, he can go to the toilet as he's familiar about his home and he know every centimeter in his home. Now the situation is not like that. If that guy with cataract, now he's living out of his home because there is no home, and now he is living in a tent, and he wants to go to the toilet, for example. There is no light as there is no electricity, and the ground is not smooth, is not well prepared. and وايش الحبال حبال الخيام في كل مكان
Ropes, yeah, and yeah,
are there. And
tent
so
ropes, a hazard, yeah, fall hazard.
most likely he will fall down while he's unable to see because of a cataract. And now, in spite of having cataract, now he will have a fracture hip or something like
Yes.
that. And it will be life-saving for him as there is no opportunity to go to the hospital. I'll just give you another example, which is a real example. As our colleagues, they tell us that most of the cases with breast cancer nowadays, they are discovered so late. I tell them, what do you expect? Actually, this is the norm for such situation because it's like that. Now, some of the women now they lost their husband, and now she's living with her children alone in a tent. She can't even close the door of the tent because there is no door in the tent. She will not feel at any time that her children will be safe by any means. The other thing, the neighbors are no longer the ordinary neighbors. Now they are new neighbors, and she is not aware about who are there. Who are they? She don't know who are they, and she will not feel safe about her children. And in each early morning, the first thing she will plan for is to go away out of that tent to collect some water for her family or some woods and cartons and other to cook for her family. And if she will discover, for example, breast lump, she will not feel safe to left her children to go to the hospital. But if there is another member inside that tent, for example, she will not have enough money to go to the hospital as there is no fuel. You can imagine, I tell you that the total salary of the people who are employee. Now, most of the people, they have even no source of money for by any means. But assume that she is one of the employees. She will get, as I mentioned, 800 shekels. You know that one package of flour, it was 1,000 shekels. So the whole salary will not be enough for one package of flour. And to reach a hospital, it will cost 100 shekels out of the 800 shekels. So she will decide not to go there. But if she have money and she will go to the hospital, she will be labeled like a cold case. And we are focusing more on the casualties and the wound infection and osteomyelitis and all the seriously ill cases nowadays. But if she have an opportunity to be managed, unfortunately, now, as I mentioned, there is no histopathologist. And if there is a histopathologist, the materials is not there. And if the material is not there, and she was diagnosed like malignancy, there is no radiotherapy and there is no chemotherapy, and she will not even allowed to be treated outside. So I'm not talking about just one event. It's just a series. And now she, by herself, she lost her husband and her father and all of her relatives. I just remembering one, our colleague, Dr. Abdul Latif Al-Haj, he's the deputy assistant. Anyone can guess how many of his family members killed? Anyone can guess how many? I don't know if you know
I'm
Dr.
really
Abdul Latif.
scared. I'm really scared to put a number, but I mean, what the
Just
picture
try,
you're
just
painting is disastrous. I mean, we can't even handle hearing it
73 members.
of his immediate family. Okay, okay. Wow.
73 members, all of his children, all of his grandchildren, all of his brothers, sisters. Again, that guy, he's one of the leadership of the Minister of Health, and he's supposed to manage the situation, which, as I just mentioned,
So
and
we are
he's
expecting
supposed
him
to
to lead
support,
this
just
disaster.
to support the others, just to support the others. And it's the same for myself and the others. My private clinic is completely destroyed. My home is completely destroyed. Some of my family is killed. It's the same. And we're supposed to support the rest of the staff and to be supporting them all the time. But really, it's not easy to do something like that. So these are part of the obstacles who are still here. I don't know how you are starting by. We don't know how you survived till now. Even myself, I don't know how that we are still surviving, but we'll continue.
I
كما
think
قال
you
الرسول
survived.
صلى الله عليه
I think
وسلم: إذا قامت القيامة وفي يد أحدكم فسيلة فليغرسها.
صدق الله العظيم. Thank you, Dr. Yusuf. I think you survived because you are special people. I really think the people of Gaza are special people. They're very strong, very resilient. I really think we all failed you. I myself apologize because we could not protect you. We all failed the people of Gaza. The whole world is complicit in this. Every single one in this world is guilty of the crimes that have been committed against all of you. And we all failed you, and we apologize. We knew this was coming, and we thought we can prevent it or protect you from this. But we failed, and there are no words to make up for this. Sorry, I apologize. Dr. Yusuf, we might come back to you after a few minutes for some questions, but let's move on with our colleagues to talk about the situation in Jerusalem, and we will come back to you.
Thank
دكتور
you.
يوسف،
Yeah.
كلنا نعتذر منكم، احنا اسفين،
الله يعطيكم العافية
خذلناكم،
ويجزيكم
احنا اسفين.
الخير. أعانكم الله. أنتم ونحن كلنا في الهم سواء. الله يعطيكم ألف عافية وربنا يتقبل منكم.
Okay. So it's my pleasure and my honor to introduce Kate Rohana. Kate is my personal friend, and she has been in the Palestinian advocacy sphere for decades. She's the founding director of Jerusalem Story. She's an excellent writer, excellent editor, medical researcher, and historical researcher. She lived and worked in Palestine several times throughout her career, and her work has been featured in The Nation, the Journal of Palestine Studies, South North News Service, and she has edited multiple books. She's a wealth of knowledge, and she has also been instrumental in the Boston Palestine Film Festival when I met her. And my introduction to Kate is incomplete without saying that we Palestinians are one people, whether in Gaza, whether in the West Bank, whether in the diaspora, whether in Jerusalem. We are one people, and we are given different tiers and different documents and different restrictions to make us seem fractured, but we are one. And we are culturally, and we are genetically, and we are so connected in community that there is no way that Lena, myself, Youssef, or Kate, who is married to a Palestinian, or Nidal are not connected. We will find the connection in a matter of 5 seconds. So it is my pleasure to welcome Kate, and she will tell us about Al-Quds, Jerusalem.
Thank you very much, Karama. Thank you. Thank you for inviting me. It's very hard to speak after what we've just heard. The magnitude of it is, I mean, we know it's overwhelming, but the specificities and the details are shocking. Even so, even for those of us who have been following it so closely over these many months, just hearing it from the ground is very shocking, and I feel like we almost need time to recover from what we heard. And I want to echo the apology that, that was expressed so eloquently, that we all failed Gaza, and I feel this myself, very much so. I mean, I'm trying to do what I can, but it's just it's unbelievable and absolutely, I don't know, there's no words. There's no words for what's been allowed to happen. And I hope that we can continue to fight in some, or to work in some regard, every regard we possibly can, to see how to change the situation on the ground. But it's really dire. Now, the situation, as Karama said, the Palestinian people are one people. Israel has worked very hard to change that, and to fragment them, and to give each population its very specific sort of set of I don't know what hell to live to live within. Jerusalem has a very specific, a very different situation than Gaza. It has its specificities. The overall kind of blueprint or intent is the same. It's eliminatory, but the way it's being accomplished is different. Obviously, today in Jerusalem, we don't see anything remotely like what we're seeing in Gaza. However, Jerusalem is, we should be aware, the largest urban concentration of Palestinians remaining. It's much larger than Nablus. The only larger ones were in Gaza, and they are, no longer sadly there. So Jerusalem is a target in that sense. It's a very large urban concentration. Now, in order to really paint the picture of what's happening in Jerusalem, and I have to go back in history some, and I hope you'll forgive me for that. I have to give you some context, because it's really kind of complicated what the structures that have been put in place in order to understand where we stand today. I'll try to do it quickly and efficiently, but I wouldn't be doing the story justice, and I wouldn't be also talking about the forced displacement properly if I didn't talk about go back in time. So Palestinian history in Jerusalem, it's centuries of deeply rooted presence in the city, even arguably back to the time of Jesus. They helped to build it, shape it, lead it. They were its mayors, its judges, its scholars, its artists, and so on. Jerusalem was under Ottoman rule from the mid-16th century to just after World War I, when the British conquered it, and they were granted a colonial mandate to rule by world authorities or something. And Jerusalem at that time was a multicultural city. It was cosmopolitan, and it was a center of life in Palestine. And it was really on the edge, on the cusp of sort of blooming and becoming something, it was very significant within Palestine. On November 29th, 1947, the UN, of course, released this partition plan for the country. Jerusalem in the plan was located deep in the Arab state. So the partition was into two states, a Jewish state and an Arab state. This was the idea. And Jerusalem itself was located deep in the Arab state, but it was meant to have its own special status, its own international status as a corpus separatum, which means a body apart. So in fact, there was meant to be a Jewish state, an Arab state, and Jerusalem as a third entity, like a third, not a state, but a third entity. The proposed boundaries of this corpus separatum were far larger than the municipality of Jerusalem's actual borders, and they included a lot of surrounding towns and villages. Now, during the 1948 war, which is the war, of course, in which the Nakba began, or what we call the Nakba, although to me the Nakba is a continuous process from up till now. But this, we call it the 1948 war, which was the war that after which Israel was declared. So in Jerusalem in specific, I should have mentioned that before, under the British mandate, there was a phenomenon that was happening where Jerusalem had mostly been in its old city, like within the walls of this old city, and then people started to move outside the old city. They started to seek more space, and this was referred to as the new city. The new city had many beautiful neighborhoods that were Palestinian built, and they had palatial mansions that were gorgeous, and it was called garden neighborhoods. They were very green and verdant, and there was a very bourgeoisie kind of existence in these new neighborhoods. So during the war, an estimated 45,000 Palestinians were driven by Zionist forces out of the new city. All of those neighborhoods were emptied. and including also villages outlying to the west of those neighborhoods. About 40 villages were depopulated and emptied. So 45,000 Palestinians from the city itself and about 28,300 from the outlying villages to the west, these 40 villages. They were emptied, and 55% of those villages were destroyed. So this was the original forcible displacement as far as the story of Jerusalem goes. Now, the declaration of the state of Israel, so basically Israel was not allocated Jerusalem in this partition plan, right? It was supposed to be its own entity, but by military force, they seized 84% of the area of what had been Jerusalem and all these outlying villages to the west. So they made like a big sort of, incursion into this, what was supposed to be the Arab state and what was supposed to be the international corpus separatum. And they took 84% of the city. At that time, if you read media reports, it's referred to as occupied Jerusalem, just as, we would talk about occupied whatever today. It was definitely a military conquest. And then as they saw all this emptying happening, Ben-Gurion is famously quoted as saying, like, the following quote: "From your entry into Jerusalem through Lifta Romema, there are no Arabs, 100% Jews. Since Jerusalem was destroyed by the Romans, the city has not been so Jewish as it is now. In many Arab neighborhoods to the west of Jerusalem, one sees not a single Arab. I do not assume that this will change." Those are literally his words. And so honestly, that's what happened. It was emptied. The Palestinian neighborhoods of Jerusalem were emptied, and it was taken by force. So now we have to understand that those Palestinians who were living there, they were citizens. They were citizens of Palestine, and they'd been citizens of the Ottoman Empire before that. So when the British terminated their mandate, they should have acquired nationality of the state that came in its place. They should have automatically become, Israeli, right, or whatever, under the state that was declared. That's what international law would entitle them to. But that was not what happened, and Israel actually passed legislation that denationalized all the Palestinians who had either left or remained and come under Israel's control in this area in Jerusalem. So their citizenship was abrogated, and they were made stateless. They were made refugees, so in violation of international law. And these refugees, where did they go? If they were sort of well off or better off, they could take refuge in the eastern side of the city, in the old city. The old city was like a safe haven in the remaining 11%, in other words, that Israel hadn't taken. Or they ended up in refugee camps around Jerusalem, specifically the Kalandia camp and Shafat camp, or they emigrated and went to Jordan. So the next thing that Israel did was it ordered all commercial banks to freeze all the accounts of all Arab customers, and they couldn't access their bank accounts. And then the British declared the Palestinian pound was no longer legal currency, so they couldn't even use the money they were carrying. So they kind of, were made completely destitute and stateless, overnight. Only about 200 Palestinians remain in the part of Jerusalem that Israel seized. And they were forced into a security zone for 2.5 years, into a ghetto at gunpoint. And when they were let out, they found that their homes had been seized and given to Jewish immigrants. And this is literally what happened. Like, this is absolutely history. So the other thing is that Israel declared in August 1948, it declared the part of Israel that it had seized, it named it West Jerusalem, and it declared it to be part of the territory of the state of Israel. And then it declared it in December to be its capital. Under the armistice agreement that was signed between Jordan and Israel in 1949, Jordan took control of the rest of Jerusalem. So eastern Jerusalem fell under Jordanian control, and the city was divided. So the key point here to take away is that in the Jordanian controlled areas, many of those Palestinians had fled there, and they were sitting there on one side of the city looking at the other side, and their homes that had just been taken were a few miles away, and they couldn't even go there. It was close to them. Then in 1949, Jordan passed a law granting citizenship to Palestinian refugees, so they got a citizenship for a time. But by the 1980s and by 1988, midway into the first Intifada, Jordan reversed course and severed all of its ties with the West Bank. So overnight, 1.5 million Palestinians were left stateless, including most Jerusalemites. So they sort of now they're in this very strange, precarious moment. But we're going to go back to 1967. I'm just describing how their legal status, their financial status, everything that they had was ripped away from them. And by the way, they were never allowed back. So obviously there were laws passed that banned them from ever returning. And even to this day, West Jerusalem is 99% Jewish. So all these losses were permanent, or never compensated. So by 1967, Jerusalem was the clear capital of the West Bank. It was a center of political, educational, commercial, and healthcare institutions for millions of Palestinians in the West Bank and even in Jordan. It had an international airport called the Calandia Airport, and its holy sites made it extremely important to Jordan. Obviously not as important as its capital city Amman, but it was very important. And the relationships between the Jerusalem and the rest of the West Bank were very much flowing back and forth. It was sort of one entity. So in 1967, during the 1967 war, Israel seized the remaining areas of the city, which it called afterwards as East Jerusalem. So that's the 11%. And in that area, they took three critical actions, actually four critical actions. They first tripled the size of East Jerusalem, expanding its boundaries northwards in a sort of finger that included this Calandia airport that they wanted and a lot of desirable land. But the boundaries also aimed to leave out as many Palestinians as possible. So take the land and leave out the people. However, this expansion still resulted in a unilateral incorporation of 28 Palestinians into Jerusalem and the arbitrary division of many other villages. So it was kind of a total geographic shakeup. The next thing they did is they extended their civil law over this area. So East Jerusalem, while under international law, it's occupied militarily, under Israeli law, it had a distinctly different status than the rest of the West Bank, so these people fell under Israeli civil law. And then Israel took a census in the days right after the war, just at the time when everything was still displaced. Like imagine a census in Gaza right now, right? Nobody would be anywhere. So they took a census, they went to people's homes, they knocked on their door, and anybody that wasn't physically in their home at the moment of the census was not granted any legal status. And basically they were exiled. So this could divide families. If you were, if you'd gone to visit your aunt in Jordan, you were out of luck, or if you were at school or whatever. So about 30,000, an estimated roughly 30,000 Palestinians from Jerusalem were exiled in that process in the census. And then the final thing they did, which is really critical, is they decided that the legal status of the about 65,000 Palestinians that they had just acquired in East Jerusalem would be permanent residents of Israel, not citizens. So they definitely didn't want citizens. Israel's whole kind of like mentality or way of operating the world, their worldview is based on the fact that they are a democracy and therefore they must maintain a majority. Like the Jews must be in a majority, in a demographic majority. This is obviously very much what partly drove them in Gaza also, because they were a demographic, huge demographic weight. But in Jerusalem in particular, it's really the operating principle that colors every single policy decision is about the demographic balance in the city. So these permanent residents, now what does permanent resident mean? It's a status that you normally give to foreigners that are arriving in a country. It's not a status that you should have as somebody that is indigenous to the country and built it over centuries and all that. So it's very distorted. And in Israel's version of permanent resident status is particularly precarious. They have a few better rights than people under military occupation, so they can move around freely, although they always have to carry their ID by law. They can vote, but only in local municipal elections. They're not allowed to vote in national elections. They're not allowed to serve as mayor. They can only serve as like a municipal councilor. And they have entitlement to health and social benefits. But most critically, this status is only granted at the behest of the Minister of Interior. And it can't, and so it's like you have to prove that you're worthy of it kind of thing. And the status cannot be passed to a spouse or a child by any right. It has to be, they've limited that in so many ways that I won't get into here, but just note that it's like very much of a conditional status. And they always have to prove they're entitled to it. So Israel soon began to be very concerned about the demographic implications of this large number of Palestinians in East Jerusalem. And in 1973, they had a government committee which determined that Israel had to maintain a demographic balance at that moment, which was 73% Jews to 26% Palestinians. Now imagine that all your policies in a city, all your urban planning, everything is like, that's the mantra that is driving it. We have to keep them at 26%, so we stay at 73%, so they can never, elect their own mayor. That, God forbid, that should ever happen. It's really kind of mind-boggling to understand this, but this is so universally accepted among everybody who's ruled Jerusalem for decades, right? This is the mind view. This is the worldview. Sorry. So the demographic trends, however, still weren't in their favor. Like the 26% didn't seem to work. Like the Palestinians kept staying, they wouldn't leave, they would have bigger families, they had a high fertility rate. And so more drastic measures started to be put into place. And this has kind of led us to where we are today. In 1991, Israel severed Jerusalem from the West Bank via a permit regime. And to understand this, you have to understand that this is a regime applied to a people, not a territory. It's called closure. And basically the closure means that people with a certain ID, which is the Palestinian ID at the time, it was the West Bank ID. Those people are not allowed to enter the city without a permit. They have to, they're individually. Now, Jewish settlers or Jews that are there, they can come and go. That doesn't apply to them. It's a permit regime applied to a people, to a specific ID category, actually. And in order to apply for that permit, you have to, go to the military, and there's a crazy number of quotas that you can or this or that reason is acceptable. And even if you get the permit, you can come in for maybe a day. I mean, so the level of restriction and control around it is insane. But it started out that way, and then it just got more and more and more restrictive over the years. In 1995, we had the Oslo Accords, where Jerusalem was taken off the table as a final status. It was put down the road as a final status issue, meaning that we're not going to resolve this now. So meanwhile, Israel can do whatever it wants. And most importantly, or very significantly, the Palestinian Authority, which was established in this Oslo Accord, was excluded by law from operating in Jerusalem. This is a very serious issue for Israel. They made it a crime for the Palestinian Authority to have anything to do with anybody 1 inch inside the municipal boundaries. So basically, what's happening to this population is that the government of the country they're living in, which is Israel, is abandoning them and has no interest in them and wants them gone. And the government of their own people, which is the Palestinian Authority, or the quasi-government, is now by law criminalized from helping them. Like literally, if they have a puppet show and there's some Palestinian Authority involvement, it's closed down. It's a crime. So they've been orphaned. This population has really been orphaned. And then in 1995, there was a policy that was introduced called the Center of Life. And the Center of Life relates to the legal status, the permanent resident status that I mentioned. Basically, the new requirement was that you had to prove, if you have permanent resident status, you have to prove that your center of life is in Jerusalem or in Israel anytime you have any thing to do with the Ministry of Interior. So if you need to renew your permit, or you want to register a birth or something. And the proof of center of life is extremely onerous. It's like there's a subjective test, which is up to the authorities to make a subjective decision. And then there's an objective test where you have to bring all these documents, like your child's school records, your water bills, your electric bills, your phone bills for like 7 years. I don't know I don't know how people do this, but they have to prove that their center of life is in the city to get their residency renewed. And because of this, many people who, I won't go into all the details. If you want more details, you can visit our website, Jerusalem Story. But because of this, residency became revocable. And the authorities started revoking residencies kind of left and right. Like you might go to apply for a driver's license and find that, your residency has been revoked and you have to leave the city. And each time somebody's residency is revoked, by the way, also their minor children who are registered in their ID also lose their residency. So, you can cite the number that 15,000 residencies have been revoked, but the actual number of people affected is more like 90,000 or 80,000 because of all the family members who are affected. So this puts the and this center of life, at a certain point, they also decided that it's not that even the occupied territories is outside Israel, right? So the occupied territories for the settlers is part of Israel, but for this policy, it's a foreign country. So if you live 1 inch over the boundaries, outside the municipal boundaries, like 1 inch inside something that is, some used to be part of Jerusalem, like everybody, understood it to be part of Jerusalem, but Israel put an arbitrary boundary there, 1 inch outside, and you can't prove your center of life, and you can lose your residency. So it's this kind of like creating policies that basically make life, unlivable and over time, right? So precarious. In the early, yeah.
Can we talk about how it is now? Because we have been hearing a lot about the massive home demolitions and the,
I'm getting there. I'm getting there.
Yeah, thank you.
So in the early 2000, they built the separation wall, which basically sliced through East Jerusalem and sliced off 1/3 of the population into neighborhoods that are beyond the wall. And the city abandoned that population. They basically said, we don't serve them anymore. So that is another factor that happened. Now, fast forward to today, the most recent data sort of show that the Palestinians are about 40%. This is Israeli data, right? So it's very underestimated, but they're showing Palestinians as about 40% of the city, but about 60% of East Jerusalem. And the status, all the trends that I've described about the status being volatile, there have been legal developments that have made it more and more and more precarious. Now, let's talk about what happened since October 7th, 2023. So with the declaration of, the war on Gaza, all of a sudden the state felt entitled to pass all these emergency laws. They allowed people to have their phones randomly searched. So you could just be, trying to go into the old city. There's a search point. Your phone is searched. If they find something on there that you liked something, like if you liked a particular post that is in their definition of, not to their liking, you could be arrested. This happened, to children. People's homes could be broken into. And by the way, Jerusalem has the highest rate of child arrest in the country. The targeting of children is very specific and sort of almost systematic. They can be arrested as young as age 12, and they get sentenced often to house arrest, long periods of house arrest where they can't have their education. And the parents become like the jailer over the child. It's even common for children to be arrested from their homes in the middle of the night, like you sleep and the police come in and they arrest you. The other thing that happened in the wake of the war, in addition to this kind of clamp down on freedom of expression and high escalating rates of arrest, was the increased closure on Jerusalem. So we talked about how Jerusalem was already being severed from the rest of the West Bank with the wall and the permit regime. Now all this access became hermetically closed, like nobody could go in and out. And for the interim first part of the war, and even the closures was around the old city also, like even people that live in Jerusalem couldn't go into the old city, and even they couldn't go into the mosque. So you have closures at multiple levels, all of which are trying to kind of de-Palestinize the city and sort of put, encourage people to not understand that it's their space anymore, in a way. Then the other thing we have very accelerated since the war is the type of invasions of homes that happen in Jerusalem in particular. So let's understand that the planning regime in Jerusalem is designed so that Palestinians can't get building permits, right? The way the building permit process goes, they are never approved for building permits, and the cost is prohibitive, but they just aren't approved for them. And because their cities and neighborhoods haven't got approved, whatever urban master plans, city plans, because that's by design, right? So they can't get a building permit, and so they build illegally. They build illegally because they have no choice. They have to house a family. And once they've built illegally, then their homes come down the road, however many years, sometimes very fast, sometimes decades, they get served with demolition orders. And the authorities arrive with their bulldozers and they just demolish the house, and the family's left homeless. Now, this is happening. This is a very very normal in Jerusalem. I don't want to say normal, that's the wrong word, but it's very typical. It happens all the time. Even in 2025 alone, I think we've already, sorry, in 2024, the highest rate of home demolitions ever, because under this new government, they're very keen on, cracking down on these illegal buildings, but it's really all about like, let's escalate our measures so it's more unlivable for Palestinians in the city. I think it was 255 structures were demolished in 2024, of which 180 were homes. The other way in which they take people out of their homes is through these specific laws that decree that somebody was an absentee. If they were absent under the specific conditions of the law, then their home can be taken and just expropriated and given over to settlers. So you have these settler groups, including officials in the government. They're all interlinked with officials in the government, the settler organizations and the government. And they go about and they study and they look for any home that might have some kind of loophole, or they pay people who are willing to be corrupt, and they then seize these homes under this supposed law and turn it over to settlers. This happens throughout the city, and particularly in specific areas that the settler organizations of the city wish to gain a foothold in, like in the old city and in Silwan. So many families face expulsion for this on this basis of this law, the absentee one. The other law that they use to expropriate and expel people from their homes relates to proving that Jews owned it before 1948. So if they can prove, or to their satisfaction, that some kind of Jewish ownership existed before 1948, they can then also expel that family from that house, even though there is no corresponding other law that would let Palestinians who lost their properties in West Jerusalem get those back. No, they're out of luck. They have no legal recourse. It only works one way. So, this is kind of like everyday norms in Jerusalem. The home's been demolished, another family's been expelled. Oh, we're hearing about another bunch of families that are going to be expelled. And it's really relentless. It's like gruelingly relentless. It's just, it's really unbearable if you're sitting there living in the city as a Palestinian. And you kind of feel so, you're precarious on the level of your residency, you're precarious on the level of your home, you're precarious on the level of your neighborhood. Maybe a settlement will come and be established. So they're also establishing settlements all the time and taking land. And most recently, another process that's been put into play here administratively is the registration of land. So Israel froze all land registration in 1967 in East Jerusalem. But then in 2018, after Trump told them that East Jerusalem was going to be theirs, and because they he acknowledged the Israeli sovereignty over all of Jerusalem, they resumed the land registration, which is and 90% of land in Jerusalem is not registered because of historical reasons. So it's really, a big open door for them if they can actually make this process work to their advantage. And that's what's happening. The land registration, which means that when you register a land to see who's officially the owner and it gets registered in the land registry, that is now being done in ways that only serve the interest of the settlers, the settler organizations, settlements, and the government, so they can come to a piece of land, start working on this land registration under the surface. The owner who lives there, the Palestinian tenant or owner or whatever, doesn't know that's happening. And all of a sudden one day they're told, sorry, this land was registered. And once it's registered, you can't undo it. It's like permanent. So then they lose their home. So it's another process. And the land registration is actually almost the most dangerous process going on. So you have all these different bureaucratic mechanisms that all fuel the same end, which is forcible displacement and, encouraging people to leave. Now, I know that there's so many things to talk about. It's hard, but the other thing I wanted to just mention is that, of course, we know that UNRWA has been banned, right? UNRWA, now, given that we had refugees, we talked about how many of the Palestinians in East Jerusalem were actually refugees. They actually benefited from the refugee services of UNRWA in specifically, especially in education and healthcare, in some areas of Jerusalem itself, and then in some other refugee camps that are part of there's only one refugee camp in Jerusalem, but another nearby refugee camp. So the UNRWA closure is going to also affect all these people that were being served by UNRWA is another another devastation for them. They don't have a way to get their medications. They don't have a way to educate their children. And of course, there isn't any plan in place to sort of come up and replace it, right? They're just taking it away. That's another factor that's happening right now. And then I wanted to mention that there's also been an education law passed a few months ago where the educational institutions. So educational institutions understand that in East Jerusalem, this is like where the Palestinian elite is educated. These institutions are really important. They have been centuries old. They might have been church established. They're one place where a Palestinian national identity can still be kind of, fostered because it's not a government school. So Israel passed an education law that's now kind of saying that any expression of certain types of things considered supportive of terrorism, which could just be like we care about the people of Gaza, that can now result in teachers being fired and schools being completely defunded. Like they can just shut down schools. So they're on attack there as well. They're on attack on the cultural front. We know and we've seen that they've attacked cultural institutions. The whole notion of a cultural institution that expresses Palestinian national identity, to them it's anathema, and they are targeting it in every way. Just this week there was a invasion of a bookshop that's a very well-known international bookshop, and they were seizing children's books and anything that had the Palestinian flag on it, and that was a huge brouhaha. The last thing I want to mention is that there is a new law that just was passed also like very, very recently, which says that the denial of the October 7th events is a criminal offense, and it's punishable by a 5-year prison sentence. So this means that everybody in Jerusalem now feels so terrified and so afraid to say anything because they can lose their residency, they can be, punished, sent to prison for 5 years. There's a pervasive fear of just absolute terror in this population. And I'm really talking about people that won't even, say a word to tell their story to us. They're so afraid that, any hint or any attention could get them these sort of like devastating results on their lives. So that's kind of a very, I don't know, there's so much to talk about, but I really, I'm going to stop there. I really hope that I encourage you to visit jerusalemstory.com and learn more.
Yes,
Thank
I
you.
Thank
put
you
a
so
link
much.
in the comments.
Much appreciated. People really wanted to hear so much more, and maybe we can bring you back and
Anytime.
talk to us more about what is happening, on daily basis right now. You touched on it, but it's very, very important. And again, we are all one people facing unbelievable odds. And facing a very creative entity that keeps becoming more and more creative in its cruelty towards every one of us, especially our children. Maisa, go ahead.
Thank you, Kate. And Jerusalem has always been at the center and the heart of our struggle and the symbol for our liberation and freedom. And obviously, as united Palestinian people, no matter where, it's my privilege and pleasure to introduce my friend Dr. Lina Al-Malak, who's not only is an exceptional Palestinian, but also the descendant of Nakba survivors. Lina is a legal consultant with expertise in tech law, data privacy, public international law, and refugee law. She's the author of Stolen Nation, The Right to Reparation of Palestinian Refugees, which was published last December. And I'm going to drop the link in the chat for anybody who's interested in her book. So Lina's going to be giving us a very informative talk on, and we're going to keep it, future focused on what the Palestinian people have in terms of legal avenues for reparation and to help us understand that in broader context. So Lina, thank you so much for being with us today, and up to you. Go ahead.
Thank you, Maisa, and thank you, Doctors Against Genocide, for organizing this talk, and to all of the great speakers. Kate gave a very thorough overview, a historical overview of land law, so I'll just kind of like build on that and just give you a bit of an overview of the various UN organizations mandated to provide protection and assistance to Palestinian refugees, which will hopefully pave the way for our next speaker, Lex Stackenberg. So we've all heard of UNRWA, which was established in 1949 to provide relief and assistance for Palestinian refugees who had fled Palestine during the Nakba. Its main objective was the rehabilitation of these refugees into the host countries. Now, a lesser-known organization is the UNCCP, or the United Nations Conciliation Commission for Palestine. The UNCCP was established in 1948 by UN General Assembly Resolution 194, which is the most often cited resolution related to Palestinian refugees and their rights. The UNCCP was created to take over the role of the UN mediator for Palestine. It was charged with finding a durable solution for the Palestinian refugee issue, and this is what we commonly refer to as a protection mandate under refugee law. The UNCCP attempted to find solutions to the refugee issue, but it became apparent that the political will needed to resolve it was lacking. And so the UNCCP has been largely inactive since 1965, apart from the digitization of its property records in the late 1990s to facilitate negotiations on the refugee issue during the Middle East process. A couple of years after the creation of the UNCCP and UNRWA, the UNHCR was created in 1950, and the Refugee Convention was adopted in 1951. And so a commonly asked questions these days is, well, why weren't Palestinian refugees included in the UNHCR? And that's because Article 1D of the Refugee Convention and the UNHCR statute has also embedded that so-called exclusion clause, is that the convention shall not apply to persons who are at present receiving from organs or agencies of the United Nations other than the UNHCR protection or assistance. At the time, only Palestinian and South Korean refugees had a dedicated UN agency to provide them with relief and assistance. Palestinians were receiving protection and assistance from UNCCP and UNRWA respectively, and hence were excluded from the mandate of UNHCR. And that was okay until the UNCCP ceased to function, because that is essentially when Palestinian refugees ceased to have protection. The legal protection of an agency that had the mandate to resolve their situation and implement a so-called durable solutions. Now, what do we mean by durable solutions under refugee law? And these consist of three options: voluntary repatriation, local integration, and resettlement. And the only solution that refugees have as of right is voluntary repatriation. In other words, the right to return to their homes. Local integration and resettlement are at the discretion of host and resettlement countries. And so we see that while the UNHCR encourages the preferred solution to displacement, which is to repatriate refugees as soon as it is safe for them to return to their homes, it's the opposite for Palestinian refugees. In fact, UNRWA was initially established to facilitate the rehabilitation and integration of Palestinian refugees in their host countries. The W in UNRWA is for works, the assumption being if Palestinians were employed and self-sufficient, they wouldn't want to return. That's kind of like the theme that we're hearing now with Donald Trump. Well, they'll have lovely homes and have to have a job, won't want to return. But the UNCCP was tasked with finding durable solutions, but it was unable to push for the implementation of the right of return or the other rights it was tasked to enforce under UN General Assembly Resolution 194, namely restitution and compensation. This led to the so-called protection gap for Palestinian refugees. There was no agency mandated to implement a durable solution for them. UNRWA has continued to provide assistance to Palestinian refugees for the past 76 years, primarily through the provision of primary and secondary education and primary health care, as Dr. Youssef mentioned, to the 5.6 million refugees in its area of operations, which are Lebanon, Syria, Jordan, but also the occupied Palestinian territory of East Jerusalem, Gaza, the Gaza Strip, and the West Bank. Now, I won't get into the challenges facing UNRWA today, its funding crisis and Israel's law banning it from operating in the OPT, as these will be addressed by Lex Tankerberg, but I'd just like to add a few words on the rights of Palestinian refugees. So as I said before, the preferred durable solution for refugees is their voluntary repatriation. The Palestinians are the only group of refugees who wish to return, but are precluded from doing so and are forced to accept a life of permanent exile in host or resettlement countries. And it's the only scenario in which host and resettlement countries are pressured to take refugees, instead of the international community pressuring the state that forcibly displaced them to allow them to return. And so that's an important point to make when addressing the Palestinian refugee issue. There's a lot of discussion as to why they're supposedly getting preferential treatment, is always the argument we're hearing, or why they are the only group of refugees benefiting from an agency dedicated to them, or why won't Jordan and Egypt absorb them, when in reality we should be asking why do we have Palestinian refugees barred from returning to their homes? And why is the international community not pressuring Israel to implement these refugees' right to return to the homes from which they were displaced within the state of Israel in accordance with UN General Assembly Resolution 194, despite the UN General Assembly reaffirming almost unanimously that right every single year for the past 76 years? And this is where the Palestinian exception lies, not in Palestinian refugees having their own agency, but in being the only refugee group denied their right to return to their homes and forced to accept resettlement or local integration as an alternative. And so our advocacy work should be geared towards that, which is essentially ending the Nakba and reversing its consequences. And it pains me to say that even within Palestinian society and the Palestinian solidarity movement, the refugee issue is often ignored or sidelined because there are more urgent matters to address, like the wall, the settlements, the status of Jerusalem, the siege, and now genocide in Gaza. And yes, of course, ending the genocide is our priority, and so is dismantling apartheid. But if we do not place this genocide or the occupation or apartheid within the broader framework and continuum of an ongoing Nakba, of a deliberate process of forcible displacement, destruction, dispossession, and a matrix of subjugation, domination, erasure, and racial segregation, we will continue to be missing the forest for the trees. We keep saying history didn't begin on October 7th. It also didn't begin in 1967. The refugee issue and the theft of Palestine as a nation are the core of our struggle for liberation. The refugees and their rights to return, restitution, and compensation were the focus of our liberation movement until the late 80s and the Oslo Accords, which is when the fragmentation of the Palestinian issue and people were consolidated. And thank you so much, Karama, for stressing that point of the fragmentation of the Palestinian people and how we are all united. But we must remember that Israel is intent on forcibly displacing the entire Palestinian population. And it is only by bringing our focus back to the core, which is the theft of a nation, that we will be able to frustrate their plans to uproot us from our ancestral land, wherever we may be, whether inside the occupied Palestinian territory, within the state of Israel, or in the diaspora. It is not a coincidence that Israel has destroyed all of the refugee camps in Gaza, and that it is concentrating its attacks in the West Bank or the refugee camps in Jenin, in Tulkarem, etc. Nor is it a coincidence that it is attacking UNRWA with the aim of dismantling it once and for all, knowing that it is the main lifeline of Palestinian refugees. Refugees are Israel's constant reminder of its original sin, of the fact that its creation and existence are predicated on the extermination and erasure of Palestine's indigenous population. We are a nation of Nakba survivors, past, present, and at risk. Therefore, instead of calling for a ceasefire now, or an end to the apartheid or the occupation, our advocacy work must encompass all of these objectives and must be geared towards ending the Nakba now. لابد للنكبة أن تنتهي. Thank you.
Thank you so much, Lina. لابد للنكبة أن تنتهي. Absolutely. And, maybe we can reach out to you for practical things that the medical community can do to maybe form our future campaigns and how we can mobilize, because we have a captive audience and we'd like to use it to create some tangible outcomes from our community. Thank you. And now it's my pleasure to introduce Dr. Lex Tagenberg, who's a senior advisor on the question of Palestine at the ARDD. From 1989 to 2019, Lex held various roles at UNRWA, including Chief Ethics Officer, General Counsel, and Director of Operations in Gaza and Syria. Prior to UNRWA, he was Legal Officer at the Dutch Refugee Council from 83 to 89. His dissertation on Palestinian refugees, first published by OUP in 1998, was later revised in 2020 with co-author Francesca Albanese. Thank you so much for joining us, Lex. Looking forward to hearing you.
Thank you very much, Doctors Against Genocide, for hosting this event and for all the important work that you do. And just picking up on your last comment, there is a group of medical professionals created in the Netherlands that now has, over the last couple of months, assembled a network of over 30 medical associations, over 100 medical associations in 30 different countries that want to use legal action to protect health workers and also challenge the pharmaceutical industries that either buy or deliver medication or medical supplies to Israel or buying from. And I don't have immediately the link, but I will look it up and share it with you guys. And maybe Lina is aware of it. I was asked to make a few comments about. I was asked to make a few comments about UNRWA. and in particular about sort of the Israeli attacks on UNRWA that several speakers have already mentioned today, culminating in the ban by the Israeli Knesset, Israeli Parliament, of the agency, and then sort of zooming in, or I'll end my brief remarks with sort of looking at the current situation. How has this ban until now been implemented, and what do we expect the weeks and months, to how things are likely to play out with respect to UNRWA. So very briefly, Lina already sort of mentioned UNRWA, UNCCP, UNHCR as the different agencies that are relevant to Palestinian refugees. UNRWA was created as a follow-up to the UNCCP and the famous resolution 194 on the right of return. It was created as an agency to indeed provide ongoing humanitarian assistance, and also to implement sort of work projects. And in a way, UNRWA was sort of an attempt to circumvent the direction that the UN General Assembly had set out in Resolution 194, focusing on a solution focused on return, by an alternative approach towards a solution based on integration in the initial host countries where the refugees had ended up: Jordan, Syria, Lebanon, the Gaza Strip, and the West Bank. So that's a bit of a political context of UNRWA. Now, UNRWA was also the agency that continued the humanitarian operations from the initial international NGOs that immediately after the Nakba had provided initial relief to the refugees. Now, UNRWA is not just, today we see UNRWA, and since the war in Gaza, we've seen UNRWA as the provider of emergency shelter in its schools, as the provider of emergency healthcare and sort of some social services. But the regular work that UNRWA does is focusing on basic education. The agency runs about 500 primary and secondary high schools. Elementary schools and primary high school up to 15 years. Comprehensive primary healthcare services through 130 health centers in the region, vocational training and education, and social relief and social services for families in hardship, microfinance services, support for infrastructure and shelter rehabilitation and camp improvement. And then finally, whenever there is renewed conflict in any of the areas where UNRWA operates, and I already mentioned Syria, Lebanon, Jordan, Gaza, and the West Bank. These are the 5 so-called fields of operation. Whenever there is renewed conflict in any of these areas, because of its large inherent capacity to provide emergency support, doctors and teachers and social workers who can, turn into emergency workers. UNRWA is intervening with emergency assistance, as we have seen it do in Gaza and currently also in the West Bank in response to the latest onslaught. So that's what the agency has been doing. And because it is directly implementing all its programs, contrary to, for example, UNHCR or other humanitarian agencies, it has a very large workforce, 30,000 employees in the region, of which 17,000 in Palestine. And 99.9% of these workers are Palestinian refugees themselves. It's only a very small contingent of international expatriate staff, including amongst those expatriate a handful of Palestinians as well, in addition to people from many other nationalities. And I had the privilege to be part of UNRWA's, expatriate international workforce for over 3 decades. So that's a bit about what UNRWA is. Now, UNRWA has always had a kind of complex relationship with Israel, almost from its establishment, and in particular, in the beginning, in the first 2 decades, UNRWA had very little dealings with Israel because Gaza was administered by Egypt, and the West Bank was under an integral part of the Hashemite Kingdom of Jordan. So it's only after '67 that UNRWA really got to deal with Israel. And initially it was Israel, almost immediately after the '67 war, that requested UNRWA to continue its operations in Gaza and the West Bank. And so an agreement was put in place, and Israel realized that if it was not UNRWA to continue operating, that under international humanitarian law, Israel would be obliged to provide those services itself. So Israel realized that it was in its interest to have UNRWA continue operating, and that's how it started. But then quite rapidly, I mean, Israel has always had a very ambivalent relationship with the UN at large. On the one hand, it owes its sort of international legitimacy to the partition resolution and then to being admitted as a member of the UN. On the other hand, it felt that it didn't like to be held to account as a normal UN member state and as other UN member state, and therefore sort of started criticizing the UN for singling it out and so forth. And it discovered that UNRWA, with this very large Palestinian staff, was sort of the weak underbelly of the UN system. It could easily criticize UNRWA for sort of, not being neutral. And that started with criticism of the textbooks, the Egyptian and the Jordanian and the Syrian Lebanese and the other textbooks that were used in the UNRWA schools. Accusing the agency to sort of use anti-Semitic materials in its schools, and that started shortly after 1967 and has continued until this very moment. When a Palestinian curriculum was established in Gaza and the West Bank, the criticism shifted from Egypt and Jordanian textbooks to Palestinian textbooks, and unfortunately, a lot of sort of unexperienced parliamentarians in Western countries sort of were influenced by sort of these repeated criticisms that the material used in UNRWA schools was not neutral, and that caused not only criticism from and pressure from Israel, but then also from Western parliamentarians. Now, then in subsequent years, Israel started accusing UNRWA's local staff for being engaged in sort of acts of terrorism. Initially, when Fatah and the PLO were still involved in attacks on Israel from Lebanon, for example, that centered on the PLO and the different PLO factions. Since Oslo, and in particular since the fragmentation and the divide between Hamas and Fatah, and Hamas sort of taking over control of Gaza, a lot of these terrorism accusations have centered on Hamas, and that culminated in the accusations that were published exactly on the day that the first genocide ruling was delivered by the International Court of Justice, 26th of January last year, with accusations that 12 UNRWA employees would have been involved in the 7 October attacks. And from that flowed further accusations and further attacks, culminating in a number of individual Knesset members presenting bills to ban UNRWA in different ways. There were originally 3 bills, one declaring UNRWA a terrorist organization, and that one was later withdrawn. But 2 bills survived and were eventually adopted. One bill declaring UNRWA operations or prohibiting UNRWA operations in what the bill called sovereign Israeli territory, which practically means East Jerusalem, because UNRWA has no operations in other parts of Israel. So the UNRWA operations in East Jerusalem have been prohibited according to that law. And a second law was adopted that introduced a sort of a no contact policy, which means that Israeli government officials are not allowed to have contact with UNRWA, whether it's in East Jerusalem, Gaza, or the West Bank. So the UNRWA operations in the rest of the West Bank and in Gaza are not prohibited per se, but Israeli officials are not allowed to have contact with UNRWA, which, as you can imagine, will then sort of quite dramatically impact the functioning of UNRWA. So where are we today? The bans became or turned into effect after 90 days from their adoption, which was 30 January. Because UNRWA feared that the ban, especially in East Jerusalem, would be very strictly applied, UNRWA sort of emptied its large field office compound in East Jerusalem. And was worried, and felt that it had a duty of care against for its staff, and therefore, did not want staff to risk going to work, after 30 January. So the West Bank compound was sort of emptied of all its record, all the documentation was safeguarded. Refugee records, also from Gaza, have all been taken to Amman, and those that had not yet been electronically preserved have been scanned and are all safe and in clouds, different, electronic clouds beyond the risk of being hacked or electronically attacked. Belgium and Luxembourg are countries that are very, have strongly supported that document preservation effort. Now, the expectation was that Israel would indeed quite aggressively prevent UNRWA operations in East Jerusalem from continuing. This has not immediately happened, and I think it's partly because of the whole hula hoop that Trump created with his call for forced displacement from Gaza, and all the sort of shock this created around the world. Also in Israel, I think Israeli politicians were sort of of course, they were welcoming these outrageous demands by and proposals by Trump, but on the one hand, and on the other hand, it also sort of took them off guard, and I think it meant that they have not immediately taken steps to close down UNRWA operations. So I understand health centers and schools in East Jerusalem continue to function. No policing, no enforcement action has been taken to close these down. Of course, the no contact policy means that the visa for international staff have not been renewed, that UNRWA cannot import goods into Gaza, East Jerusalem, and the West Banks, with which requires cooperation of Israeli customs and other government branches. In the lead up to the ban, this means that, for example, in Gaza, a lot of other humanitarian agencies have brought in goods that UNRWA needs for its operations. World Food Programme has brought in food not only for its own humanitarian program, but also in order to support UNRWA. So there's currently a lot of measures that are happening to sort of effectively keep UNRWA from continuing to operate. How long that will work, not just in Gaza, but also in the West Bank and East Jerusalem, is very much still up in the air. There is a very dark cloud of these bans hanging over UNRWA's future. And then this is further aggravated by the fact that in the lead up to this ban, there were a lot of international efforts at sort of trying to secure the agency, including by UN member states. There was strong action in the General Assembly, of course, not in the Security Council due to the American veto. Norway took an initiative to take the UNRWA ban to the International Court of Justice for a further advisory opinion, and that is in motion. At the end of in another 10 days, there is a deadline for member states to make written submissions on the case. There is a hearing set for early April, and so that case is moving forward. Leading to another advisory opinion of the International Court of Justice, a kind of complementary request, complementary to the momentous advisory opinion that was rendered in July of last year, and that declared the entirety of the occupation illegal, including the settlement enterprise, and instructed then the General Assembly, following that opinion, instructed Israel to end the occupation by September of this year. So this further advisory opinion will complement that opinion of July of last year. So yeah, that's the situation. Donors are also sort of sitting on the fence because they say, well, if UNRWA can no longer operate, do we have to give the money to other UN agencies? And this is something that is very dangerous because UNRWA has faced a chronic financial crisis over the last decade, and that is far from being over. A lot of new donors have stepped in. A lot of private funding has also been channeled to UNRWA, especially through an organization that is called UNRWA USA, which is essentially a US support committee for UNRWA that has raised a lot of funding, and it has, especially since the start of the genocide, become one of UNRWA's larger donors, even larger than many governmental donors. So that is very encouraging. So let me end here. If there are more questions about sort of where things are with UNRWA and where you think we are heading, I'm happy to answer those.
Thank you so much, Lex. Any questions, Karam or Nidal? Or anybody from the participants? I think like the obvious question for me is obviously how can we as the medical community mobilize and advocate for reinstatement of UNRWA? Any tactical ideas or tips that we can share with our members?
Well, primary health care is the second largest program that UNRWA provides, not just in Gaza and the West Bank, but also in Jordan, Syria, and Lebanon. And therefore, advocacy by the medical profession, medical associations, towards that aspect of UNRWA's work is very important. And UNRWA has developed its primary healthcare program in very close partnership with the WHO. Actually, UNRWA's director of health is seconded by the WHO, is a WHO employee seconded to UNRWA, and UNRWA's model of primary healthcare services has been intensively researched by many different organizations, universities, and others as one of the most cost-effective approaches to delivering quality primary healthcare services to a large community. In this case, a refugee community, but a protracted refugee community. So what UNRWA has been doing in terms of its comprehensive primary healthcare services is not different from public healthcare systems around the world. And many countries around the world have been actually looking at UNRWA's approach to primary healthcare services. And even approaches like oral rehydration salt have been piloted by WHO in UNRWA health centers, 60, 70 years ago, for later application around the world. So the UNRWA primary healthcare system is worth being part of your focus, and this is something that advocates, including myself, for UNRWA have been underscoring, and the same applies to UNRWA's education system. These are approaches to education and primary healthcare services that have been developed in the education sphere in partnership with UNESCO, have been developed and refined over 7 decades, and by forcing UNRWA to end that whole sort of incredible achievement runs the risk of going down the drain, and that is even much more critical than the immediate impact on the humanitarian operation in Gaza and the West Bank, as important as it is. But yes, humanitarian services can potentially be taken over by others. But the healthcare model and the educational model that UNRWA has so successfully developed, is much harder to take over by others. So just want to make that point.
Very good, thank you. Because there's some, sometimes there's the question is who will take over from UNRWA, and it sounds like a simple question, but
yeah, no, it isn't.
Are dangerous, and we need to be very clear on our position that we want to support the reinstatement.
Absolutely.
With something else, yeah.
And with education also being so important, I mean, the Palestinian population, especially in Gaza, is highly educated. The literacy rate is very low. Right now, we are seeing the complete destruction of the universities and the schools. So people are eager to have their children resume their
even
education.
under the current rubble, people are trying. Yeah,
100%. So for us, education and health go hand in hand.
I mean,
And this is why we insist on UNRWA being restored and UNRWA being funded, and we will continue to demand that and work on that.
Absolutely.
Yeah.
It's very important.
If actually, as you remember, Dr. Yusuf Abu Rish from Gaza just mentioned that 70% of the primary healthcare services in Gaza are dependent on the UNRWA, and 50% of the education service, especially for elementary and middle school. So, I mean, the presence of UNRWA, their service, their network is massive, and there is no other organization that can replace them in a timely manner. And thank you, Lina, for for highlighting also that Israel was established, it was created on the sin. It was established, imposed on the region through a sin, through the complicity of the United Nations itself. It's United Nations itself committed a crime against the Palestinian people. The whole West implanted this illegal implant and foreign body in our region. And that is the source of all the problems, all the sins. The presence of the refugees is a reminder of Israel, of the original sin they committed. And although in the beginning, because they did not want the refugees to go back, and at the same time, they don't want to provide for them, they supported the presence of the UNRWA, because the UNRWA will serve two purposes. First of all, the refugees will find a place, so the urgency of going back is not as much. Plus, there is an international body that is providing for them. So it's like, for them, it's a win-win, two wins. But now, since they are ready to go to committing the second big sin, which is to forcibly displace the rest of the Palestinians, erase the memory of this, refugee problems. They don't want the UNRWA now because it's a constant reminder of that sin. So that's why now they want to get rid of the UNRWA altogether, and planning to do the, forced displacement of the rest of the Palestinians in the West Bank and in Gaza. From what we know is the mandate of the UNRWA. The mandate of the UNRWA, as long as there are refugees displaced from Palestine, then the UNRWA mandate continues until these refugees are returned back to their homes, not displaced further. I want to clarify this, Mr. Luxembourg. Tuckerberg, what is the mandate of the UNRWA exactly? I mean, the UNRWA will continue to exist under the international law or UN mandate until the refugees go back home?
What it turned into, I mean, UNRWA's mandate started very short term and in the hope of integrating the refugees in the host countries as an alternative to return. At the same time, in the resolution establishing UNRWA, at the insistence of Arab states, it was stipulated that this would be without jeopardy to their right of return. So over the years, the understanding has become that UNRWA is to continue to provide its essential services, education, healthcare, social services, microfinance, until a just and durable solution to the Palestinian refugee question has been found, with sort of return at the center. And sort of that is the current understanding by the parent organ, by the UN General Assembly. And on that basis, every 3 years, UNRWA's mandate is renewed, and has been renewed over the last 75 years. So yes, UNRWA is expected to, and this is also being, in the whole discourse around the Israeli attacks, in the response to the Israeli attacks, UNRWA and the UN Secretary General and the General Assembly has continued to highlight that it is not up to a member state to try to sort of evict a UN agency from its not even from its own territory, as far as, because even East Jerusalem is illegally occupied by Israel. So that Israel is not, it's not up to Israel to prevent a UN agency from operating in occupied Palestine. And this violates, flagrantly violates international law. And UNRWA is there to stay until indeed a just and durable solution has been found. So that is the ongoing mandate of the agency, and on that basis, the agency continues to be funded and continues to be renewed every 3 years.
So, despite that, this state that was illegally established by force and by an illegal resolution from the United Nations without taking the consent of the native people of the land, despite all of this, this state that was given legitimacy by the United Nations is coming now and not allowing the United Nations agencies to operate and function. And it has been rejecting and not abiding by any UN or United Nations Security Council resolution since its inception for the last 70 years. What is the United Nations response for this? Can they expel this state? Because there is a charter in the UN. I remember that if there is any state that continually rejects all United Nations resolutions, General Assembly resolutions, Security Council resolutions, not allow UN agencies to operate there, is there any grounds or basis to expel Israel from the United Nations?
Well, let me first make it clear that the United Nations is not sort of a supranational organ with divine powers. It is a forum, a club of the member states of the world. That is what the UN is, and therefore implementation of international law and implementation of the resolutions that the organs of the UN adopt, the General Assembly, the Security Council, and other organs, Human Rights Council, require the will and the action of the member states. Now, what can the UN do? What are the powers? Yes, in principle, it can expel a member state or suspend a member state from the organization. But like admitting new members, expelling or suspending members requires a decision of the Security Council. And there, in any of the decision making of the Security Council, there is the veto of the Permanent Five. And we know that Israel has been shielded from any acts of accountability by the United States. Now, is there anything more that can be done? In the General Assembly, the US does not have a veto. And in the General Assembly, there is a mechanism where every year all the 193 members have to present their credentials in order to take a seat at the table, so to speak. Now, with respect to South Africa during the apartheid era, the General Assembly has reached a measure to deny South Africa's credentials in the General Assembly, and that happens through a credentials committee. And that is essentially a majority decision of the General Assembly. The US has no means to deny that. So there is currently debate, especially in the aftermath of the advisory opinion of the International Court of Justice on the illegality of the occupation, and the very strong General Assembly resolution that was adopted in follow-up to that opinion, to indeed revoke or to invoke that instrument to deny Israel a seat at the table, and that is something that is under active consideration by the state of Palestine, by other Arab states, as well as by now there is this group of 9 that has established the Hague platform to, try to hold Israel to account. So I would not be surprised, especially if as is expected, Israel will not comply with the demand of the General Assembly to end the occupation by September of this year, that Israel could be denied a seat. And that means effectively suspending it from any engagement in the United Nations, because Israel has no seat on the Security Council. And if it no longer has a seat in the General Assembly, it is effectively, given a very strong signal that it is placed, that its sort of pariah status is sort of confirmed by the General Assembly. So that is definitely something that, and I don't know whether Lina has anything to add on that front. Feel free to weigh in, Lina.
Thanks, Lex. Actually, not so much on this issue, but I actually want to go back to what can be done as individuals, maybe not just as healthcare workers, but overall as citizens of wherever we may be. And I think one of the things that we were seeing play out recently in the news is this kind of almost normalization of a talk of forced displacement, and that we have a role, all of us, to position this conversation not so much as a debate over policy, but rather really focus on how this is an attempt to normalize the abnormal, the illegal, the crimes and the war crimes and the crime against humanity. I mean, some of the headlines that were in the papers recently, including the Wall Street Journal, about population transfers, is just incredibly, mind-boggling that we are having these types of conversations in this day and age when population transfers have been illegalized and have been made, illegal. That we are normalizing this discussion of forcible displacement. And another thing, also to counter these efforts to forcibly displace Palestinians. I mean, we keep obviously saluting the strength and the resilience of the Palestinians, but ultimately Palestinians are not superheroes. They are human beings, and in order for them to be able to have that resilience and sumud and ability to stay in their ancestral land, we have to put pressure on our governments to insist on the reconstruction of Gaza, and put that pressure on Israel for them to force Israel to implement all three phases of the ceasefire agreement and begin the reconstruction of Gaza as soon as possible, so that Palestinians are able so that life is sustainable in Gaza, and so that Palestinians are able to remain in Gaza and not be forced to leave it. It is cruel and unfair to expect Palestinians to remain in their land in tents with a decimated healthcare system, with a decimated educational system. That is not a sustainable life, and that was clearly by design. And lastly, in terms of I think we were talking about legal action. And I think some of the legal actions that have been very effective are legal actions against organizations that are working towards this or contributing to the displacement of Palestinians and their dispossession. For example, the Jewish National Fund, the JNF. The JNF, there was a very successful campaign in Canada which led to the stripping of the JNF of its charitable status. This precedent gave impetus to an organization in the UK to demand from the Attorney General to strip the JNF of his charitable status in the UK. These are successful, targeted campaigns that achieve results, and these are campaigns that are people-led. You don't have to be a healthcare worker or a lawyer or anyone else to push for these campaigns. Similar campaigns can be made, or legal actions against the organizations, the real estate agents that were selling property in the occupied Palestinian territories, and we're going on a tour, basically advertising these properties in cities like Toronto and New York and Chicago and so many other places. And so targeted legal action against these real estate agents that are selling expropriated land that was stolen from the Palestinians. These are the types of legal actions that are targeted, people-led, and effective, basically. So that's I just wanted to add an angle as to, because we constantly ask ourselves, what can we do? And we're not powerless. It's just that we're perhaps not necessarily directing the action where it could be most impactful.
Thank you, Lena, and thank you, Dr. Tuckenberg. We really appreciate your insight into this. We have Dr. Yusuf Abarish is back. We know it's a little bit late in Gaza, so thank you for coming back for some questions and follow up on the situation that he presented in Gaza. I know it's late in Gaza, but I feel like Gaza is always morning. I always like to say good morning, Gaza, all the time, because I think Gaza is the only light in this dark world and this dark humanity. Dr. Yusuf, I want to start by asking you, first of all, thank you for coming back. The question is, what is your ask for us as the medical community? What can we do? What is the most imminent need now that we as doctors, healthcare workers globally can help, immediately? What kind of intervention or any place for us that you think to help support the plight of our people in Gaza? Then we'll open the floor for a few more questions from my colleagues here. Dr. Yusuf, are you there?
Yeah. Actually, I can apply for that question. We need everything actually because they distract everything, and now we are in need to rebuild everything. You know that we put a plan for how we can respond, and actually we bought 4 Rs. R1, which is responding to the emergency situation, aiming that to provide a very essential services and life-saving services, and the R2, which is restart. Restart, that meaning we are going to restart the already existing and the remaining existing health facilities, and those facilities who are in need very minimal intervention to restart. And during that phase, again, we are going to have our assessment for the health system, and the restart is just starting when the ceasefire is there. Actually, we are feeling that we are in between R1 and R2, between the responding phase and the restart, as there is no permanent ceasefire till now. R3, which is the rehabilitation, and we are meaning that rehabilitation for the health system and the health facilities, which is in need for major intervention. And R4, which is the rebuilding or reforming and rebuilding of the health system. Actually, as I mentioned, we are in need for everything. But if I can just prioritize them, first of all, we are in need for the advocacy, of course, to advocate from your side and all of our colleagues just to keep the momentum and to keep advocating. That is something which is so crucial and so important. Of course, we are still in a bad need for the supplies and the chain supplies regarding the medicine and the consumables and the instruments and the lab reagent and the spare parts. All of these are on the top of our priority. And number 2, I think it's focusing on the primary healthcare as the first line of defense and the public health measures. And number 3, focusing on the health staff and just trying to keep the staff not to have a decision just to go outside. You know that some of the staff are just going to leave as there is no schools for their children, there is no universities for their children or the rest of the family. There is no private sector to work in. Actually, they destroy everything. So some of our doctors are trying to go outside. So I think to keep the staff there in Gaza, it's so important. You know that at any time we can bring some of the devices or the equipment, but to have an expert doctor, we are in need to for a minimal 15 or 20 years to have an expert doctor. So I think to support the health staff by any means, mainly the consultants, to keep them inside Gaza, it's something which is so crucial.
Dr. Youssef, how do we support the Ministry of Health directly without going through NGOs? Is there a way that we can do that?
Yeah. Yeah, if there actually there is many ways to support, as you mentioned, through some of the NGOs like PAMA, UK Med, BSRF, MAB UK, Norwalk, all of those NGOs. Actually, they are working and doing a very good job and with the close relation with the Minister of Health. But if any of the organization want to support directly, we can manage like that to have one of the company or can deliver some of the medicine to the Minister of Health, and you can pay for them mainly for who those companies who have the ID or have their ID bank outside Gaza. So you can pay for them after they deliver the medicine to the Minister of Health.
Okay, great. Because one thing that you mentioned is the brain drain, or removing, having better pay, even if it's meager outside the Ministry of Health, might cause a lot of the employees to leave the Ministry of Health. So we want the Ministry of Health to be as strong as possible, and supporting it is extremely important. So maybe we can just talk later and understand a good mechanism for that.
Yeah,
How about
even we have our platform. We have a platform for the different needs and the different priorities. I can share that platform for you, so anyone can go through that platform and he can choose where is the area who is just interested in, and then we can continue how we can apply the
Perfect.
support accordingly. I
yes,
can
Dr. Yusuf,
share,
please,
I can
please
share it now.
share that platform with us. That's very
Yeah.
important. I just came to my mind, like we are used to the concept of sister cities and sister, stuff like that, like cities in the West, sister with cities in the East to support them. But how about we have the concept of sister hospitals? Like any one of us who are working in a hospital in the US or Canada or in the West can have a sistership relationship with a hospital there, the Ministry of Health, any of their hospitals, and they can support them by sending, supplies, staff, medications, and also support their staff there too. I don't know if this has been tried before, but I really think as healthcare workers here in the West, it should be an easy ask for us, each one of us, to approach their hospitals and tell them. I mean, there's no politics. No one's asking you to have any political decision or opinion. This is just supporting a hospital, and if you can sister with, let's say, Al Shifa Hospital, and you can be very helpful to send them medication supplies to support their staff there. Even, it should be very easy because, I mean, what Dr. Yusuf is mentioning, their pay for the staff is very nominal compared to the West. So it shouldn't be really hard. And I think this should be a good project that all of us can start thinking and brainstorming and make it a reality.
Yeah, I think we can support the staff in many ways. One, actually, to support the families of the staff, mainly for the staff who killed. Actually, we have more than now 1,000 families. They lost their parents or ايش بيسموها معيل الأسرة. Actually, we
Yeah,
have
they're a provider. They are the
yeah.
provider for the family.
Yeah, so to support the family themselves as they no longer have a provider, that's the number one. Number two, even to support the families for the detained doctors and the health staff. Oh, we have, as I mentioned, hundreds of the families now. They are there and they have no source to be supported. I think that's important. Number three, the new generation of doctors who mainly who are will start their residency program. You know that we have a very important cornerstone, which is our residency program. Previously, we have 750 doctors in the different levels of our residency program, which is containing more than 17 different specialties. And now we are in need to push more new generations in the residency program because they will depend actually on that staff in the future. So I think to support them and to have some twinning or any project just to support that number. For example, now we are planning to push almost 80 new doctors, new generations in the different specialties. So to support those doctors, I think it's the best way to support the system as a whole, the doctor themselves and the whole service, and then to let them be specialized here in Gaza and to be trained here in Gaza.
Yeah, this is really important. Instead of supporting people to leave Gaza for training and residency and education or even work, or even trying to duplicate the work of the Gazan systems by NGOs. It is always more important and more helpful to the people to help the native structure, the existing structures there, to help them, give them the capability and support their ability to train their students, their doctors there, and to support their systems. Because I mean, this is their white saviorism or the NGO model of duplicating the governmental institutions has always proven to be harmful to the people who are receiving this aid. It is always more important, more beneficial to help the ministry, the institutions, the hospitals, the universities, the schools that are there to do their job, because usually this has public benefit for everyone, instead of limiting your work to duplicating small pockets here and there through NGO work or through helping people leave rather than stay. So
Yeah,
thank you, Dr. Yusuf.
even if they will continue their post-graduation outside, it will be easy for them to leave or to continue their work outside Gaza. But if they will continue their specialty and the general specialization here in Gaza, so it will be even more difficult for them to leave, as they will marry here and they will build their family here and they will build their job here and their relations here. So it's a mean of just keeping them inside Gaza rather than to let them leaving Gaza outside.
Dr. Youssef, people are asking for the platform, so if you can send it to us, that would be great, so we can.
Yeah. I'll send two messages. One for the some of the active data which you can use, and the other one, actually I already sent that one, and the other one, which is the platform, I'll just send it just a few minutes and I'll send it for you.
Great. And also, a lot of people are interested in doing a peer-to-peer support system with doctors from the US or doctors internationally supporting the doctors and their families inside Gaza.
Twinning, for example?
Twinning between individuals and between hospitals or between cities. So if we can facilitate that with you, that would be great, and we can do that offline.
Yeah, I'll be more than happy to support or to help or to facilitate anything like that.
شكرا يعطيك ألف عافية.
يعطيك الف عافية.
Should we move to Adla now?
Adla's been very patient. You're mute, Adla.
You're mute. بدنا نسمع صوت. We want to hear you.
Asked you to unmute.
We cannot unmute
There we
you.
go. Did it unmute?
Yeah.
Adla.
Can you hear me now?
Yes.
Okay, sorry. Okay, so good to see everybody. I'm here to just talk briefly about the Hill Day that we have planned on Wednesday the 19th. So this is our action, our advocacy day on at the Senate, at the United States Congress. And I'm happy and I'm proud that we have a little over, I believe, 100 healthcare workers that have signed up to participate. From a logistics standpoint, many of you know about some of this, but I'm going to just try and quickly reiterate. There is an opportunity for us to gather together the night before to organize ourselves for those who are available. But if you can't make that, that's okay. We do plan to meet at 9 o'clock at Union Station in the central lobby area, where we'll have some time to organize ourselves and to divide ourselves into groups where we can divide and conquer in terms of offices so that we do not repeat ourselves. We ask that everyone wear, if you have a DAG white coat, that's fantastic. If you do not, a white coat, scrubs. If you have a DAG pin, lapel pin, you can wear that. We ask that no one wear a keffiyeh for this day of action on the Hill. And so I just want to briefly start off about talking about, like, the framing of why are we doing this. Many of us, when we started, had never been on the Hill, and we had never advocated or had never met with any of our elected officials. Many of you have and are veterans in this area. But some of the talk that we've had is about sticking to our asks. And the reason for that is, I think, some of us, when we first got on the Hill, with the gravity of the situation, we were very raw, and we spent a lot of our time venting. And thinking that the point of us going there was that we were going to change these minds immediately, because of the situation demanded it, and time was very much and is of the essence. And I think, with some more time on the Hill, some more experience, we still bring our urgency, but we understand that this is a very long fight. And those of us in the belly of the beast, unfortunately, really, I think, feel that. And most of us are deeply knowledgeable about the political aspects of this, because genocide inherently is political. But to the best of our abilities, we are trying to stick to a medical perspective. And that is not because we think that we are not capable of having those discussions, but it's because we think that this is the most effective strategy to achieve our goals, which is the actual point of why we're going. And this can be very, very hard, because the people on the Hill, they want us to go into politics. And why do they want us to do that? Because they want to dismiss us as these rogue, out of touch physicians who do not represent the medical community, when in fact we do, because we are humanitarians. So, beyond ending the genocide and advocating for sustained health and safety of the Palestinian population, the point is to make our continued presence known, and to let Congress know that we are not going away, that we are going to apply sustained pressure. We are hoping to sway opinions and provide information, but we understand that these are the starts and maybe the second portions of conversations, of ongoing dialogues. The other side has had a continued presence on the Hill. They are steady, they are consistent, and they achieve their goals by wearing people down. And we have to take a lesson from that. It's an effective strategy. So some of these politicians are banking on the fact, or banking on the idea, that this part of the movement is going to get tired, worn out, because they understand that we are professionals with limited time. And so we cannot let them do that. So I want everybody to think about, these, the day on the Hill, in sort of two ways. Those where we have an appointment with the senatorial office, and those that we don't. At present, we have 9 appointments with offices, excuse me. We hope to have more. Many times we don't hear from people till very last minute, and that's why the schedule is in flux, but we are very flexible, and we're able to accommodate, and we will flex how we need to flex. But we have opportunities to get appointments on the fly, or at the very least to leave materials. And I'll talk about that a little bit more. I want to emphasize that all of these senators have websites that you can easily navigate. You can see how they voted. You can see their positions on relevant issues. They all have a section with a press releases, which usually will demonstrate a position that they have told, as well as how they have voted, a resolution that they have supported. You can filter it by issue, and you can filter it by year. Okay, this is easily accessible on your phones. We have Hill reports that we're going to hopefully have an updated version that we can provide for everyone, so that if you do not have an appointment, or even if you do, you can leave these materials with the offices that you're meeting. If you're not able, if you don't have a scheduled appointment, but you think you're going to achieve an appointment on the fly, preferably with a chief of staff or someone of similar stature, you want to try very hard not to be left with the intern. But if you do, it is what it is. It's better than nothing. And so what I would say is, if you're only left with leaving a Hill report, you want to ask for that communication after the fact, that the report will be read, that it will be discussed. You're going to take down notes of with whom you left that report with, you will get a name, you will get an email, and you're going to be very clear that you expect follow-up, and you actually are going to follow up with an email so that you can continue the dialogue, even if you haven't had a chance to speak with a staffer for any length of time during that visit. I think particularly for the offices where you have an appointment or you are going to be granted an appointment, it is very important that you have at least some clue on the senator's positions. I mean, a lot of it is, so, Democrat, Republican, you can kind of get a sense like from right then and there, but like that's not enough. And, some of these senators, there are egos involved. And so if you do not have some clue, one, it's you should know their positions, one, because it's more effective, two, because it shows a sign of respect. But then also just because, you want to try and get off on the right foot. So in any case, that's where I think, looking at that website in particular can be helpful, especially if you are going into a state where you are not a constituent or you're not particularly familiar with the politics within that state. But keep in mind that, you don't have to be a constituent to go into these offices. We are a national, global organization. We're going to do our best to actually provide numbers for everyone prior to Hill Day with a breakdown of the number of constituents that are actually there for a given state, but also the number of constituents that are present across the organization. We can say that we have over 15,000 members. With respect to what our goals are for this particular day of action, we have very specific asks and directives, and this is actually something that we've learned over time. Going in there and just sort of like venting about the situation with very sort of vague asks is not effective. We need to give them specific asks, specific things that they can do, and then have a dialogue, because the last thing you want to do is just talk at them over and over, and then because you're letting them off the hook if you're not demanding for there to be some back and forth in the conversation to understand where their senator is on a particular position, to also offer how can we help you to do the right thing. So with that in mind, we do think that we should have limited groups. It's best to introduce yourselves, to have assigned roles. You want to have a speaker, you want to have clear asks, you want to have someone taking notes of what's actually been discussed, and you want to plan for follow-up with a contact so that, again, we can have follow-up meetings. And that doesn't have to be on the Hill. All of these senators have local offices. So if we're able to get contacts and set up some meetings, we could potentially set up meetings in the local offices with our constituents who are not able to be part of this day of action, but who can continue the dialogue for us on behalf of DAG in their local offices. So in terms of what we're asking for support of Senate Resolution 68, which is sponsored by one of my senators, Tim Kaine. It's co-sponsored by Van Hollen, Ossoff, Warnock, Blumenthal, Welch, Wyden, and Duckworth. And for me, that's an interesting list. And I don't want to spend a lot of time on this, but this is where it actually shows that it's important for us to not just go by the offices where we're trying to sway people, but we should spend a little bit of time going by the offices of people who sponsored and co-sponsored these bills to express our support and appreciation for what they have done. I mean, I'm going to give you an example. Ossoff, he's a Georgia senator. He's the first Jewish senator to ever be elected in the state of Georgia. He's up for re-election in 2026. And just today, the New York Times published an article discussing how there were a group of 50 organizations of synagogues and Jewish constituents in December of 2024 who sent a private letter, but it's gotten leaked out, asking Governor Kemp of Georgia, who is a Republican governor, to run against him. And it is based solely on the fact that they were unhappy with his votes surrounding Gaza and Israel. And specifically, while the article I don't have the New York Times, I don't have full access, but I saw an article that referenced the New York Times article, specifically because he was one of the 18 senators that signed on to Bernie Sanders' resolution in November of 24, asking for limiting and conditioning of weapons to Israel. That's like less than 5% of the weapons, and they want to get rid of him based on that vote. Moreover, there were quotes in that article where people were saying Kemp is Republican. We disagree with him on the vast majority of positions, but on this issue, we will vote for him because of his because he will vote how we want him to vote on Israel. So I think it's important, that we go to these offices and say, we support you. We appreciate your principled stance. The next resolution is Senate Resolution 5388.
Can you please say what does that resolution say, the 68?
I apologize. Yeah.
Please.
So
Go ahead.
essentially, I had it written out and then my entire internet went down, but I have it. Hang on. So
It's the
essentially,
one
it is
that
asking for the United States not to deploy military assets or personnel to Gaza for the purposes of taking over Gaza. It goes on to discuss, it does all the normal stuff you think about, but it does have a paragraph about not supporting the takeover of the Gaza Strip to forcibly relocate its people, whereas the Palestinian people have the right to self-determination in their own independent state and to live with dignity and peaceful coexistence with their neighbors. And they talk about how it's not in U.S. interest to assert control over Gaza and that will fracture partners in the region and around the world. It talks about Iran. I think some of it is because there is, an express interest about not wanting to deploy U.S. armed forces and to foot the bill. And I think that that's interesting because, having been on the Hill, one of the co-sponsors is actually Duckworth, Tammy Duckworth. We have not been able to move her in 17 months on
I'm surprised.
anything,
I said, well,
not
surprised
on
to hear that.
anything, not on UNRWA, not on ceasefire, nothing, not on supporting, limitation of offensive weapons, nothing. I mean, we even, went to her saying, you have lost your legs. Don't you have sympathy for the children of Gaza who are amputated? No movement whatsoever. And I read her press statement on this. It's just a small blurb, but I think that even for her, deployment of U.S. troops was a bridge too far. And so I think that there is opportunity to capitalize on people for whom they don't give two you-know-whats about Gaza or the people of Gaza, but they care about U.S. troops and they care about US dollars and military spending when it comes to US troops, not on bombs, but on US troops. And so that's why I was kind of reiterating and sort of hammering home we don't want to waste our precious minutes. Okay. This is going to be like 15, 20 minutes tops with these visits, but to have some inkling of where that senator stands on an issue so you know where to start the conversation. Okay. If they are military, heavy military, this is an angle you can choose. If they're an evangelical, don't waste too much time. Okay. You can try to go over the humanitarian, appeal to the humanitarian piece of it. You can appeal to the fact that the Palestinians are the Christians, of, the original Christians of the world. You can try that. Okay. But just know your audience and then quickly pivot into the talking points. So Senate Resolution 5388 was sponsored by Welch. It's co-sponsored by Sanders, Van Hollen, Hirono, Klobuchar. I was a little surprised by that one, and Merkley. And just want to circle back, Ossoff is the one who's the most vulnerable. He's up for re-election in 26. The rest of them are all a bit safer. They're in 28 and 30. I think there's only one other, Merkley, who's in 26, but he's relatively safe. He's from Oregon. And so that one is about reinstating funding of UNRWA. And so that one came out in November. And I do think, we need to absolutely ask for support of that. In terms of finding, like-minded people from a humanitarian perspective, we have to do our best. But there's so much false rhetoric behind the role of UNRWA. So we just have to do our best to advocate, I think, from a healthcare and a humanitarian standpoint, and try our best to not get pulled into the weeds, because that one in particular, I think the offices will take advantage of that and try and pull us into the weeds.
If you don't mind, Adla, I just want to add. So, I mean, when we talk about the UNRWA thing, I think it will be very important to mention what Dr. Yusuf shared with us, that UNRWA is responsible for 70% of primary health care in Gaza and the West Bank, 50% of school education for the children. So this is to push back against, the accusation of terror and stuff like that. Plus, the important thing about this resolution is that the Senate is going to vote at this resolution, I think the end of this month or early next month. I'm not sure about the date. So it's very timely that we push these two resolutions. I mean, two asks, very clear. They are very important. Both of them are very timely. And the staffer or the senator will not have the excuse to tell you, oh, but I don't know how to do that. It's very evident. All what you need to do is just sign up or co-sponsor or sponsor these already existing resolutions. Very clear ask, and we should expect clear answer. Thank you,
I
Adnan.
was just going to add too, if you do have a personal story, like if you know someone who has been a beneficiary of an education in a UN and UNRWA school, who is my brother-in-law was plucked from an UNRWA school and is now an ophthalmologist at Johns Hopkins. I plan to use that. He is, the story of what Palestinians can achieve when they are given opportunity and how they serve the United States. So anyway, so with that, and then our other asks are a draft resolution. We're asking them to draft a resolution for absolute protection of healthcare workers, and the release of Dr. Abu Safia. And if they don't know who he is, we should educate them on who he is and what he's been subjected to, and that this is in violation of international law. If there is an opportunity, I have tried in previous instances to draw parallels with how, when we do not speak out about desecration of hospital infrastructure, about abduction and torture of physicians, we have opened Pandora's box, and we don't only it's not just what we're doing to other countries, but it's what we are doing in terms of what we think is allowed and acceptable within our own nation. I've been able to get through to a lot of my colleagues by saying, you're now expressing concern about ICE coming to our hospitals. Why are you surprised that these sort of things are happening now? Healthcare physicians and healthcare facilities are no longer sacred spaces. And so I think, if there's an opportunity for that to just try, I don't know if you guys want to go into that, but just in terms of the idea that healthcare, spaces and the ability of a doctor to deliver healthcare is a sacred space, and that it should not be controversial. It should be a red line. I have a rep who is actually undergoing treatment for a malignancy right now. Many of our senators have had either family members or themselves with their own health scares, and so I think that part of the way you can apply that from a healthcare perspective is to talk about, imagine, you guys don't think that this can't happen here, but it can. This absolutely can happen if we allow this to be greenlit around the world. And then if you have time, there are a few other talking points, that if you can get to it, we want to talk about the protection and the permanent and protection of the current ceasefire, implementation of all three phases of a ceasefire, and absolute protection of a permanent ceasefire. We'd like to be able to sponsor children, to treat them in the United States with a caveat that they have the guaranteed right of return, because some of us are becoming increasingly concerned that some of these families are being split up with one parent exiting with a child and they're not being allowed to return. And then we want to have unlimited aid to the Gaza Strip and to the West Bank, including aid from the United States. So I think these are all very specific asks. They touch on a lot of things. You want to try and get through them as quickly as possible so that you can actually have a back and forth dialogue, so that you can understand where your senator is on a given position, and with the goal of continuing the conversation and understanding that we have to have continued pressure.
Yeah.
Thank you, Doctor.
Can I
تفضل دكتور
add
يوسف.
just one point or 2 points before before leaving? One, I don't know if it will be good to prepare, for example, a meeting with some of the patients themselves, some of the stories of the patients who can just talking about their painful stories. We can prepare something if you want to have a such meeting, just to invite some of the doctors or whatever you want to invite, and we can just prepare some of the cases who can just talk about their painful stories and situation. I think it will be good, and even we can just have another example or model or session with the doctors and the nurses who were detained or were affected or injured or have some painful stories. I think that will be good. The other thing I will just refer to the platform of the information and the data of the Ministry of Health. It's a reactive one. You can choose any of the variables and you can choose the time and you can compare and even you can follow the data progression and regression according to the time and the different variables. So I share again the website of the Ministry of Health data. You will find lots of information there, and you can compare according to the data you would choose in a reactive manner. Again, I would like to thank you for this invitation. Thank you a lot for your great effort, and I hope we can meet in another meeting, inshallah.
Dr. Yusuf, thank you for being with us. It is an honor to have you. And it's not like we can have, patients from Gaza or doctors be with us. We would be honored to, and we would love to have actually patients or doctors from Gaza be on our meeting every week. We are having this meeting every week. So if every Sunday we can have 2, 3 patients or their doctors, their nurses with them to speak, their truth, their injuries, what's happening with them. We would love to because we want the whole world to see firsthand what is happening, what are the crimes that committed against these people, and what is their tax money paying for to murder and mass murder children and women and grandmothers and grandfathers. So please, Dr. Yusuf, I'll stay in touch with you and we can arrange this whenever it's feasible. Every week we can have a patient or 2 or 3 or a doctor, healthcare worker be with us to share these, factual stories with the rest of the world. I already shared also in the chat, please, anyone who was asking about the ministry, the link for the Ministry of Health and how they can support them. I already shared them in the chat. If someone did not see them, please reach out to us. We can share them with you again. And actually, we're gonna try to get some links. Go ahead, Karam.
To follow up on Adla's part, which is our Day on the Hill, we do have a letter campaign that sends a letter to the representatives, to the senators who sponsored these, we are hoping to sponsor these 2 resolutions. And please sign our letters because we will use them when we go to the Senate and the Congress, and we will actually share them with the actual offices. So the more people who sign, the stronger our asks will be. And we will put them on, they are on the emails that you guys received, inviting you to this webinar. We will have them in the chats here, and they are on our social media. We are really trying to get as many letters signed and sent to the representatives as possible. Maisa, maybe you can share the one in the chat again. Thank you.
And Adla, do you have any follow-up notes? Okay, so thank you, everyone. I know our meetings tend to take longer, but they are still necessary and important. Nothing we do is enough to support our people in Gaza and to expose the crimes that are committed against them and to bring their voice to the world. We will continue to do this every week. Please let your friends, your colleagues join. It is very important for everyone to know exactly what is happening in real time from the victims themselves, to hear their stories, their voices. our colleagues in Gaza, Dr. Yusuf and his colleagues who endured 16 months of genocide and continue to endure genocide by other means, by deprivation, by not allowing any medications or supplies to go in, by forcing conditions of life on him, on his colleagues, on his people to make life unlivable in Gaza. It is our role as people of good conscience in the States, all over the world, to be their voice, to support them, to do everything we can to support them and to protect them from the other side, who is very well intent on destroying them, forcibly displacing them. And I really think lately we have been start talking about the world as two sides: the good people on one side, the bad people on one side, on the other side. There are good people everywhere else in the world, and those good people should all join forces, join together, regardless whoever they are, whether they are American, whether they are British, Canadian, Palestinians, Chinese, whether they're Muslims or Christians or Jews, regardless of ethnicity, regardless of nationality or location. The good people, the people of good conscience, everywhere else in the world should unite, should speak up, should support each other to protect the goodness of this world from the evil that is being visited on us by supremacist institutions, supremacist culture, supremacist leaders and ideologies. The forefront of them is Zionism, and that is built on a genocidal project and continue to thrive on committing more crimes and more genocide, and with full support of the Christian Zionism and the American administration that funded, enabled, and armed this genocide and continue to enforce it by all means. So we need every voice, we need every one of us. We know they have a lot of power, but we do have the numbers, we do have the truth on our side, and as long as the truth on our side, we will win, inshallah. شاء من شاء وأبى من أبى، واللي منهم مش عاجبه يشرب من بحر غزة. صح دكتور يوسف؟
أكيد أكيد أكيد، الله يجزيك خير،
الله
احنا
يخليك.
متفقين تماما. الله يعطيك ألف عافية.
يس، والله يصبركم، الله يقويكم، وكلنا مع بعض وإن شاء الله صامدين، وإن شاء الله النصر قريب، وكل هاي البلديات ما راح
إيش
تروح
أكثر
ببلاش.
كلمة، أكثر كلمة متداولة في غزة؟
شكرا everyone.
إذا بدنا نسمع إيش أكثر كلمة
إيش أكثر
متداولة.
كلمة متداولة في غزة؟
ما تقلقوش.
تقلقش، أحسنت.
تقلقش، ايوه.
تقلقش.
do people
Don't
know على
worry.
فكره. تفضل تفضل احكي. انا
تقلقش.
لازم نعلم الناس الكلام الغزاوي، لازم على فكره لغه العالم هلا تصير غزي، والتروث اوف ذا وورد should be غزي.
تقلقش
العالم
تقلقش.
غلط. احكي لهم
تقلقش means
كلمه.
don't worry.
مهما كان الظرف صعب، مهما كانت كل الدلائل والمؤشرات بتقول إنه هناك مشكلة كبيرة، بيطلع لك واحد من نص الكل، بيطلع لك هيك بيقول لك تقلقيش، تقلقيش.
شو معنى
وفعليا
تقلقش؟
الحمد لله الأمور بتمشي، الحمد لله. تقلقوش، إن شاء الله الأمور بتمشي، وحنعيد ونبنيها بإذن الله.
ان
يا
شاء
رب
الله، بعد
يا رب
الوضع
إن
صعب
شاء الله.
والله
حالة
يعينكم.
الإصرار. أخوان، أنا اليوم كنت في غزة. حالة الإصرار والتشبث في الحياة والقدرة على إعادة البناء شيء لا تتخيلوا، لا تتخيلوا.
والله يا
سبحان
رب.
الله، هاي سنة الله على فكرة. هاي الغريزة البقاء عند الإنسان فعلا. إنه يعني إحنا صراحة، بدك صراحة دكتور يوسف، إحنا بعاد وقاعدين هون كل واحد ببيت ومكيف ومي وأكل وسيارات ودنيا ودين، بس مع الأخبار صار عندنا يعني complete exhaustion and depression just watching the news. ف we cannot even imagine, we cannot even
دكتور، أنت ما
come
بتعرف
close to
يعني
يعني تخيل شو
الحديث
كيف صامدين أنتم.
الحديث يعني مهما وصفت، يعني ما بتقدر أنت تتخيل عمق الألم. يعني أنا بدي أقول لكم مثال بسيط بسيط، ما يمكن ما بيخطر على بال أحد. أجت زارتني أختي في المستشفى، وبتقول لي، طبعا ركزت، قعدت على الكرسي عندي في المكتب، فهي بتقول هيك: أخيرا. بقولها إيش أخيرا؟ بتقول: أخيرا إلي الآن 4 شهور أول مرة بأركز ظهري، لأنه في الخيمة قطعة قماش ما بتقدر تركز ظهرك.
يا حرام.
واو
واو.
واو.
يا حرام.
كمال لا يمكنك تتخيل أصلا هذا الموضوع.
واو.
التفاصيل اللي موجودة لا متناهية. تتخيل إنه أنت تكون قاعد 4 شهور لا تتمكن بس إنك تركز ظهرك. بس هذا الموضوع البسيط بس هيك تتخيله. الله المستعان يا دكتور.
Yeah, we take too many things for granted فعلا. يعني you never feel the value of things until you lose them. مسكين يعني it's just a very simple thing you can it doesn't even come to the mind. مثل فعلا الواحد ما بتخيلش ما بتذكرش انه في شيء زي هيك انه اصلا it's a thing. بس الله بعين
أقول
يعني.
لكم أقول
على
لكم
قدر البلاء ان شاء
نكتة.
الله بيجي
أختم
تعويض.
أختم بطرفة أختم بطرفة بحكي لي يا
تفضل.
دكتور أحمد شتات. دكتور أحمد شتات مدير عام التعاون الدولي. فجالس هو وزوجته. طبعا زي ما قلت لكم هي الخيمة الفاصل اللي بينك وبين الجيران قطعة القماش. قطعة القماش يعني ممكن بكل سهولة تلاقي رجل واحد عندك تلاقي إيدك عند الجيران أيا كان. فهو قاعد وبيحكي لزوجته يعني شو بدنا نعمل للأولاد وكيف بدنا نخطط للمستقبل. قال فجأة جارنا بدأ يشاركنا النقاش ويقول ويقترح علينا بعض المقترحات. ويقول لنا والله أنا بنصحكم تعملوا 1 2 وما تعملوا 3 و4. فهم قالوا له شكرا على المشاركة وإحنا ممتنين جدا لهذا المبادرة والروح الإيجابية الموجودة عندك.
صار
وأخذوا قرار
جمعية
إنهم ما
على طول
يحكوش.
كل شاركة.
وأخذوا قرار إنهم ما يحكوش في الخيمة بعد هيك.
مم.
واو.
الله بعين. الله بعين.
sense of humor تبع أهل غزة مش معقول.
فظيعين فظيعين.
معقول. مدرسة والله، مدرسة والله.
مم. وعلى
يعطيك
فكرة يمكن هذا
العافية.
اللي مصبرهم، لأنه I don't think ما في أي شعب ثاني بيتحمل اللي صار فيهم بصراحة. ما حدا بيقدر يتحمل هيك شيء. طب دكتور، مش
عقبال
المفروض انهم موافقوا انهم دخلوا التنس وهاي الموبل هومز وإشي
دخلت التنس البريف فاب. لسه إلى الآن ما دخلت. دخلت تنس على شمال قطاع غزة تقريبا صاروا مدخلين حوالي 50 ألف خيمة. لكن عدد البيوت اللي مدمرة تدمير كامل ولا تصلح للحياة. التقدير الأولي 300 ألف وحدة سكنية.
واو.
دول تايمز 5 300.
300 ألف وحدة سكنية.
الافريج عدد
يعني
السكان.
لما نحط عدد الافرج كل عائلة فيها 5 أشخاص هو 4 أشخاص ونص. هو كالمعدل العام في غزة. أسيوم منها 5. إحنا بنتكلم على 1.5 مليون واحد بلا مأوى.
هلا دكتور يوسف، انت في غزة في الشفاء
أنا ما بين الشفا وما بين مستشفى ناصر. الآن في مستشفى ناصر.
ناصر.
صباحا كنت في الشفا والآن في مستشفى ناصر.
انت صعب تزور الشمال؟ هلا في مجال انك تروح تزور الشمال ولا
بروح
ولا
بقدر
صعب؟
أروح. نعم لا بقدر أروح. صباحا كنت في الشفا بمعنى يعني في الشمال. الشفا في القاطع الشمالي.
اوكي.
وبالتالي بيصل الشفاء بيصل لبيت حنون وبيصل لكمال عدوان. زرنا مستشفى كمال عدوان والإندونيسي والأهل العربي كل المستشفيات زرناها.
تنقل ما بين المناطق يعني
المناظر من جباليا وبيت حنون إشي ما بتصور العقل. مش طبيعي، ماسحين كل شيء.
مسح كامل ما في أي شيء. لا تكاد ترى شيء يعلو فوق سطح الأرض.
واو.
هلا احنا المنظمه تاعتنا كانت دائما عندنا مقوله انه احنا هاي المعونات الايد مش هو اللي كثير مهم. المهم انه البوليتيكال سوليوشنز. بس هلا لانه الوضع تغير، لانه هلا بدهم يستخدموا الايد as a weapon to force people out. صار الايد هو by itself is the action، وهو the form of resistance انه allowing aid. فالصراحه كثير صرنا هلا نركز الادفوكسي انه to allow all aid، خاصة انه الهيفي things الهيفي equipment that can يعني remove the rubble, that can fix the roads, that can fix the infrastructure. Because I think that is their plan. That's why they are delaying this as part of their plan to force people out.
Yeah,
يعني have no other
exactly.
choice. You cannot of course يعني even you can be the strongest person in the world, but if there is no home, there is no water, there is no infrastructure, there is no house, and you have kids and stuff, I mean, they want to no hospital, so they want to force you out by all means.
Yeah, exactly. I'm totally agree.
Okay. شرفنا دكتور. Thank you انك كنت معنا.
شكرا. شكرا
Thank
شكرا
you
جزيلا.
everyone.
جزيلا
And إن
دكتور.
شاء الله please دكتور فكر فيها شغلة الأطفال أو قصد المرضى أو الدكاترة أو أي حدا بليز. إحنا مستعدين كل أسبوع موجودين هون. احكي معنا ويجوا
يمكن
باولها يجي باخرها اي وقت،
يمكن هو
يجوا
الوقت
ساعه يجوا ساعه whatever they want، احنا we are flexible، لانه احنا دائما
يمكن هو الوقت يمكن الوقت في غزة بالنسبة للمرضى يمكن يكون متأخر، لكن ما بعرف هل بالإمكان إنه تحديد أي وقت في الفترة الصباحية اللي حتكون عندكم في الفترة المسائية. يعني يمكن يكون أنسب في هذا الوقت. صعب إنه المريض إنه نجيبه ونقول له تعال تكلم، لربما يكون محتاجين توقيت آخر، لكن أنا بشوف إنها فرصة مناسبة. قصص الناس يا أخواننا، قصص الناس ما بتتخيلها. يعني أنا قبل كم يوم كان معي دكتور محمد أبو سلمية، بتعرفوه مدير الشفاء.
نعم
سمعنا إنه واحدة من زميلاتنا بتشتغل في الاي تي، في الانفورميشن تكنولوجي، توفى زوجها وجميع أبنائها وهي مصابة. فالزوج وجميع الأبناء وبعض الأخوة والأخوات كلهم توفوا. فإحنا رايحين بدنا نعزيها ونقول لها يعني شد حيلك. والله يا إخواني وزملائي، إحنا ألجمتنا الكلمات وغصت في حلوقنا كل المعاني، فأصبحت هي تصبرنا. يعني هي قاعدة بتصبرنا، وهذا النموذج بيحصل بشكل شبه يومي، إنه
لا
إحنا
حول
بنقعد
ولا قوه الا
عاجزين،
بالله.
ما بنقدر نتكلم، فبصير صاحب المصاب هو اللي عم بيعزينا وهو اللي عم بشد من أزرنا. هذا النموذج مش يوم، مش واحد ولا اثنين، مش بصير بشكل اكسبشنال. اليوم هو هذا النورم تبع الناس. هو هذا الدرجة العالية اللي حتى الواحد نفسه، أنا مش متخيل أنا نفسي وأنا قاعد في غزة. والله يا أخوانا أنا مش متخيل درجة الصبر اللي موجودة عند الناس، والقدرة على الصمود، والقدرة على التمسك بهذه الأرض. النماذج اللي شفناها ما بتتخيل إنه في بشر موجودين على الأرض بهذه النماذج. دكتور مش دكتور مثلا، دكتور ابن دكتور حسن، ما
بدكم
بعرف اسمه.
توقفوا التسجيل؟
احنا ممكن نوقف الحديث كله
لا
ونقول
لا
لكم
لا بنكمل
اشوفكم على
التسجيل،
القاعة.
وقف التسجيل، خذ راحتك، مع انه
وقف تسجيل يعني.
مع انه تريلي بالي عادي. يا
كيف؟
تفضل.
اه يلا.